Medical professionals of Reddit, what is the craziest DIY treatment you've seen a patient attempt? I'm a dental student where we see mouths in pretty awful condition. One guy came into the emergency clinic with teeth half rotted off from decay and told me he has been putting gummy bears in the holes to make it less sharp on his tongue. That reminds me of the time when I tried to DIY a tooth from a Mentis because I had lost a tooth just before the day where we took school pictures. I remember I was rolling in stomach pain and went to the doctor because my mom could not stop giving me chamomile tea all the time instead of actual medicine. It was not my stomach. I went directly to her since one of my ovaries was full of cysts and some of them exploded. Update. I took the Plan B pill and according to the doctor those cysts were caused by the pill. I don't know what to think about that. Update 2. This year it was my second time taking this pill. My body recognized the medication and did not have other reaction than my period coming 3 days before the estimated date. From now on, since I am child free, I will save money in order to go to a clinic and having spay-neuter surgery. Oh man, I am so sorry. I have cysts on my ovaries and one burst. I woke up my roommates and my then boyfriend, now husband, came over, middle of the night, picked me up off the floor, and rushed me to the ER. In comparison to the contractions before I had my kid, the burst cyst was worse. I'm a physical therapist, and this was more on accident than a DIY, but I think it still fits. My patient was diagnosed with frozen shoulder and one day over the weekend he was getting into his garage when his arm hand got caught. The automatic door raised up and brought his arm with it. He came in the next week saying he was fine and no longer had problems with his shoulder. I joke with all my frozen shoulder patients that they should just try this at home. Infections of the skin of the external ear canal are common and treatable. Hard to get to though. A dairy farmer who didn't have time to see us got a long rubber tube that he used for something to do with cows, not sure what, fed it into his ear canal, then poured cow antibiotics down the tube. He came in when it didn't work. Seeing a doctor in the UK is free. I'm a doctor, but didn't see this firsthand unfortunately. However, my friend in ED saw a young 17-year-old boy that came in with personal trauma and mild blood loss. She triaged him, taking him to a room with his parents and asked what he'd come in with. His mom turned around and said, "Go on, tell the lady what you did." He then proceeded to tell her that he tried to circumcise himself with scissors for religious reasons as he hadn't been circumcised when he was younger, but had to stop halfway due to pain. Eventually the shame had grown enough that he had to tell his parents, who immediately took him to ED, some antibiotics and a revision by urology later, and he was able to be sent home. Another one I know slightly unrelated was an older man that came in with penile swelling. He'd used an elastic band as a makeshift ong ring, but neglected to take it off. I have no idea why. He was a little odd to say the least. A week goes by and his penis starts to look literally like an aubergine. He then comes into the surgical assessment unit and we see him there and is booked for surgery the next day after we eventually picked our jaws off of the floor. He had literally killed all of the tissue in his penis to the point it was almost falling off. One full penectomy later and he now only sits to pee. I'm not sure how he tolerated the first day. It must have hurt so much before the tissue died. What the frick is wrong with people in this thread? Parents sneaking essential oils onto their premature baby's skin. They have central lines. These oils can wick onto the line and damage the line, cause infection, or interfere with medications. Infections in preemies can mean death within hours. Preemies have incomplete skin with much faster absorption rates than fully developed adult skin. These oils can cause burns and damage their insides. Your pyramid scheme company is not a reliable source for neonatology treatments. Please dear God, keep oils off of any baby, but especially preemies. Dental office. Patient comes in with veneers on her front teeth she made herself out of acrylic nails, the pomade sets you can buy at Walmart. Surprisingly it looked okay from a distance, but the amount of random glue she used in her mouth to get them to stay will probably come back to haunt her later. Woman I know has a dog that is epileptic but was not willing to medicate the dog for some time. She kept trying holistic remedies, one of which she informed me about was giving the dog all natural vanilla ice cream during a seizure to stop it. You know, because you should always try to put stuff in the mouth of a seizing animal. It didn't work. The dog is on meds. Seizures are controlled now. Imagine that. There are some weird conditions that cause low blood sugars occasionally in growing dogs. My brother's bulldog would get this weird little seizure tremor activity, but when you gave him a little ice cream, it cleared up incredibly quickly. That's probably what they meant to rule out, I guess. Not me, but my mom had a gentleman walk himself into the ED one day after he tried to give himself a vasectomy with an animal neutering kit he bought on the internet. When she asked him why, he told her that his wife wanted to have a 6th kid and it was too expensive to pay a doctor to do it, and how hard could it be to DIY. That is a man dedicated to not having another kid. Worked in pediatrics for a few years, and we had this one family come in with a kid who was burned by one of those microwave ramen soups. They put duct tape on the now blistered skin to keep it from popping in the car. Interesting fact, microwave noodles are the #1 cause of burns in children. Guy had abdominal pain, drank a bunch of beer and tried to give himself an appendectomy with a steak knife on his front porch. Wife calls 911 after she see him performing seppuku. We roll on scene and ask him if he want treatment. Ride to the emergency department. He looks up at us, looks down on the mess he has made, says, "Hang on, lem see if I can fix this first." He then tries to cauterize the wound he made with his cigarette, realizing that isn't working, and goes, "Well crap, let's go, I guess. I fixed the coffee machine, Martha. I can fix myself too." Still a student, audiology, but I had a very elderly patient come in with broken hearing aids. He said they were dirty, so he washed them in the sink with soap and water. Pro tip, hearing aids are not waterproof. Yes, he was warned of this when he first got the hearing aids. Thankfully he was still under warranty with the company and they were kind enough to let him slide on this one. Otherwise that would have been $4,500 down the drain. I work in a pharmacy, and one of the pharmacists that was there filling in that day told me that during his morning shift he had a woman call and tell them she pulled out her own IUD and wanted a painkiller recommendation. I cringed so much when he told me, as I had just gotten mine switched out that same day coincidentally and was still in quite a bit of pain from it. Turns out, there are DIY instructions on Pinterest on how to do this. This should go without saying, but please don't do this. Go to a professional if you want it removed. A friend of mine said her insurance pays to put it in, but not take it out. So she used Pinterest videos and removed it herself. She's fine and said it didn't hurt, but I cringed when she told me. Plus insurance is fricked up. If they weren't willing to pay for removal, they shouldn't pay to put it in. IUDs don't last forever. Not a doctor, but my grandfather was in decreasing health. Over the course of a few weeks he got to where he was having trouble breathing occasionally. So he gets the idea that he will go get an O2 tank to help him. Does he go to the doctor? Number. He goes to Tractor Supply and buys an acetylene torch, brings it home and hooks it up. Whenever he would get short of breath he would go in his office and only turn on the O2 before sticking the hose up his nose. I'm not a medical pro, but here's a story. My friend's dad got skin cancer on his right bicep. And at the time he was a large muscular man who ran a horse farm, huge arms, and so instead of going through all the normal BS of one getting skin cancer, he caught it early and thought he could stop it at the source. So he heated up a railroad tie steak with a massive torch he had on his farm, till past red hot, and shoved it into his arm where the skin cancer began. He did this twice, to himself, and wrapped up his insane burn hole in his arm. A while later he went to the doc, who said the burn he inflicted was the craziest crap he's ever seen. But all signs of the cancer were gone. He freaking killed that crap and it never returned. His arm and burn healed months later and he remains cancer free to this day. EMT here. Showed up to this Russian guy's apartment for a severe back pain call. Said he's had this pain for 6 months and became an alcoholic to deal with it. His wife was hammered as well and they both passed out the second the ambulance started moving. Patient was told they had an infection from leaving their contacts in too long. Decided to clean their eyes out with hydrogen peroxide. 2 cornea transplants later. So sugar can be used to help heal certain types of wounds. A patient I saw had missed an appointment with part of their care team where they get their bandage changed. I noticed what appeared to be oozing around the edges of the bandage. Asked my patient about it, offered to change it for them. We didn't typically do that in our clinic. They said yes. I go get fresh bandages and whatnot. Take the old one off and it's just sticky and stringy. Picture the slow-mo shots of caramel being pulled apart, and it smelled. To be fair, most wounds smell, but this was different. I finally asked them what they used to change their bandage since I knew it wasn't discharge. Maple syrup. They used maple syrup. When I was a kid, like 12, I dropped boiling water on my stomach. Microwave accident. Babysitter had me put toothpaste on it. Even as a 12-year-old I understood that this made zero sense. In short order the burn started burning worse. I got it off and just left the wood to the air. Later on in a doctor's office I was told I did the right thing. People are nuts. Not a medical professional myself, but during my PhD in gastrointestinal sciences I attended a lot of clinical seminars. One doctor described having a patient with severe colitis who was so desperate for relief, the patient had their healthy sister poop in a blender, which they used in an enema as a DIY fecal transplant. As an aside, fecal transplants are a remarkably efficacious treatment for some forms of colitis, so this wasn't totally out of left field. I've actually been tempted to try that. Thankfully my new gastro finally got to the bottom of the problem. I was on a dental mission trip in Oaxaca, Mexico, and a poor farmer came in with a toothache on one of his front teeth. It looked like it had had some work done to it, so I asked him what it was. He said he did a root canal on himself. I inquired further. He had a toothache, so he took a drill to his front tooth to give himself a root canal. Short of it was, it didn't work. Had a patient try and buy syringes from my pharmacy for injecting the dog. With what, you ask? Gatorade. My wife's dog has been really lethargic the last couple of days, so we were going to try and give it some fluids in case it's dehydrated. The instinct for some would be that it was just an IV drug user seeking clean needles, but I can assure you this gentleman thought his logic was sound and in fact intended to murder his wife's dog, injecting it with sugary Powerade. I wouldn't call it a treatment per se, but the patient did. I work in a home healthcare system. Patients have long-term IV accesses placed and are able to infuse sterile medications intravenously at home. Well, this patient kept getting really bad blood IV line infections almost weekly and having his line replaced. No one could figure out why, and line infections aren't very common. He also was running out of saline flushes a little quicker than he should with no explanation, so the line was being maintained appropriately at least. Finally, while a nurse was there to get labs, change his dressing, and check for infection, things finally clicked. He had been crushing pain pills, mixing with saline, and injecting it directly into his line. When asked directly, he didn't deny it. The response was, well, no one told me not to. Yes we did. We told not to put anything we didn't provide in there, and the pharmacy providing the pain meds put take by mouth on the little bottle. He got repeated painful infections, MRSA, and thousands of dollars in unnecessary hospital bills. Idiot. TLDR. If you put things directly into your bloodstream that are not aseptic, you're gonna have a bad time. Had a guy make a Dewey penis pump. Used it and realized he forgot to make a relief valve, and he used mostly metal tube. So yeah, fireman had a fun time with that one. Plus his penis came out huge, and I mean huge, also black and blue. This was before I became a combat medic. I was working at a hotel as maintenance. Suddenly the fire department shows up with an ambulance right behind. Turns out one of our guests decided to try anal sex for their honeymoon. Since they thought her butt was dirty, they would clean it out with a fifth of vodka. So he shoved the bottle up there and she almost immediately went unconscious. They hauled her off and she almost died from alcohol poisoning. Buddy of mine was doing a EMT rotation while stationed at featuring. Brag, he got called to a barracks room by a very scared female. He was the first in the room and found a male soldier tied to the ceiling by a chain above his bed and was naked. He had a blanket wrapped around his lower half. The young lady sat crying in a chair as he removed the sheet. The guy had a metal coat hanger in his rectum. Apparently he liked that kind of stuff, but the lady had inserted the hooked side and not the straight side, so it was stuck. He was transported face down butt up on a stretcher with the sheet to cover him, but he still had a nice antenna wobbling about. Dog came in with some terrible abdominal swelling, lethargy, and BP so low we took 30 minutes to find a vein for blood work. I go in to talk to the owner and see he has Cushing's. I ask what he's being treated with. She proceeds to tell me he's not on medication and hasn't been ever. Medicine is bad for dogs. She opted to treat with miracle plants and supplements instead. These supplements cause the dog to deteriorate quickly. He died within a few hours. The animal ones make me sad. They're depending on their human to care for them and they're killing them instead. Sad. Finally, something I can add to. When I was in med school on my family medicine rotation, I was sent in to see a middle-aged woman with complaints of sinus congestion. Sure enough, from the beginning I can tell she's really stopped up with her nasally voice, and my history and exam are consistent with your run-of-the-mill viral upper respiratory infection. I begin educating her on symptomatic management and the following exchange ensues. Patient: do you think it might be the flu? Me: it's possible but unlikely. It's really out of the typical season. It was June. Patient: yeah, I guess I wasn't sure it was. I've been spraying Lysol everywhere and it doesn't seem to be doing any good. And it says it kills the flu virus. Me: well, that's something that could help disinfect the house and keep the virus from spreading. Patient: I guess. I just wish it didn't burn so much. Me: what do you mean, it burns? Patient: you know, when I spray it up my nose it burns so bad. Yep. My patient thought that since Lysol kills influenza, the best way to nip it in the bud was to flush her sinuses with it like a saline spray. It did not work. For the record, the fact that I didn't immediately fall over laughing and instead seriously counseled her against ever doing that again is still the greatest featuring of composure in my entire career. TL. DR. When the label on Lysol says not for internal use, they mean it. Not for internal use. Now it says that. It was marketed as a douche and birth control in the 1920s. My wife works in the ICU. A dude tried to cure his heartburn with a remedy he read online. Baking soda. Only he used too much baking soda and drank it with Coke instead of water. Completely wrecked his intestines. Not sure if it fixed his heartburn. Background info for those who don't know, a pessary is a device that women, usually older, can use to place inside their vagina and help support it. Sometimes with age and history of many childbirths, the ligaments that support the walls of the vagina within the body can become loose, leading to prolapse, meaning it starts to fall down into itself like a telescope. The pessary acts to hold it up and keep this from happening. Anyway, I'm an end surgeon, but my buddy told me the story of an experience in the OR where a lady came in with the chief complaint of roots coming from vagina. Turns out she had lost her pessary and decided to use a potato. It stayed in there for so long that it started to sprout. This story made me ever so happy with my career decision to choose the opposite end of the body. Edit. Into itself, not into Italy. My mum has that problem but uses the proper medical equipment. She did tell me that her grandmother used an apple to do the same job. Apparently it was pretty routine to use produce of some sort. I just can't see how you get from part of my body is falling out to a Maris Piper or Golden Delicious will be just the thing. Had a patient today with diabetes who was taking himself on and off his meds as he pleased. He would stop taking the meds whenever he thought he was getting better, and then when he inevitably started gaining weight again he would start taking them again. This is unfortunately common. Had a dude try and pull out a rotted tooth with pliers. Kid had a drug test the following day, so to cleanse his system he drank a jar of pickle juice and then busted open a bunch of niacin pills. Patient with festering leg wounds that wrapped them with tampons and duct tape. First time I saw maggots in a wound. Stuffing raw bacon in their nose to stop a nosebleed. But it actually kind of worked. Why to many people with big pus collections under their skin that get drunk and stab them with broken glass or something else sharp. Many YouTube videos can demonstrate. Niacin to defeat a drug test is a common one. I doubt it helps at all and it probably makes you feel just awful. Just hydrate, kids. Drinking plenty of water is the only help you can get. A nurse once told me about this young homeless looking hippie guy who was admitted for a nasty cut on his leg. Apparently it had gotten badly infected because the guy was attempting to treat it by putting finely ground marijuana into the wound. I feel like dumping weed into a wound is more expensive than just getting stitches. Not a doctor, this is actually me. My great-grandmother once tried to give me a tablespoon of sugar and kerosene when I was feeling sick. Thankfully my mother intervened. The all permanent cure. Can't be sick if you're dead. Egg whites cure giant abscesses, except you wind up arriving in full-blown septic shock instead. Working as a field paramedic, get called to a guy's house. His problem originally was constipation. 4 days of constipation. We get there and he's sitting on the toilet and says he can't get up. First thought, he must have some other problem too. If he can't get up, nope. First thing he asks is if we can just reach up in there and pull the poop out. Then he tells us he tried but couldn't get it loose. But he did push it around. We of course say, no, they'll deal with that at the hospital. So why can't you get up? Then he tells us, and also demonstrates. He tried some laxatives, 1 dose for each day he hadn't pooped. Took them all at once, edible ones, that help loosen things up, starting from the top of the digestive tract and working their way down. They were working their way down, uncontrollably. It was like a flood being held back by one last huge boulder at the mouth of a cave, with spurts and sprays going around the boulder. But the boulder was holding firm. 30-minute drive to the hospital later. Goop boulder he made by jamming his finger into his butt held firmly in place. But the diarrhea mudslide his superdose laxatives created was still making their way around the jam and spreading across the stretcher and ambulance floor. Irresistible force met a movable object in his butt. Vet student here. We once had a family that came in when their dog ate a bag of Easter chocolate. We had to induce vomiting, but first asked if they had tried anything at home. They said they read online to make the dog eat a bunch of salt to make it throw up. This poor dog had a bag of salt repeatedly poured down its throat before he came in. Pro tip, if your dog ever eats chocolate and you panic, have him ingest about 2 tablespoons of hydrogen peroxide. He'll vomit out liquid frothy chocolate, so put him in the bathtub immediately after. Save your dog. Save your carpet. Please take him to the vet also. The hydrogen peroxide is just in the event that you can't rush him in. Excellent tip. Thanks. My dog got into my big Hershey chocolate bar and ate the whole dang thing. I didn't find out until hours later. He was as fine. Dentist here. A lot of people come in with that temporary filling material from Walmart packing into broken teeth. If you have a big cavity that is abscessing, don't plug the drainage hole. The cavity. It's like plugging a volcano. As a side note, I'm really surprised Walmart hasn't been sued for that. Jesus. The last thing I'd want to do with a big cavity would be to put something in it. I work in Amish country. The general rule of thumb is that the first line of treatment is to rub kerosene on it, no matter what the injury or ailment. Woman treated a cat bite by putting bacon on it to draw out the poisons, except that didn't work and she ended up on IV antibiotics for 3 days. Plus she wasted good bacon. This happened before I was a doctor. A neighbor kid had a small cut on his hand that became inflamed. He thought it was a good idea to douse it with hydrogen peroxide and use a non-sterile sewing needle to poke holes in and around the injury so the hydrogen peroxide could get into where the infection was. Even as another dumb adolescent, this sounded stupid to me at the time. Not a medical professional, but a buddy of mine who used to work in an emergency room had someone come in with fingers blown off on the 4th of July. His mom handed the doctor a Ziploc bag with red and white in it. Apparently she put his finger remains in a bag of milk to be reattached, because that's what you're supposed to do when you lose a tooth. That's a good way to kill an amputated body part. Putting severed digits in water, or in this case milk, would cause cell death. They'd absorb too much fluid and burst. Direct contact with ice kills tissue too. Take an amputated body part, bag it and put it on ice. Called over to take resin of an ancient guy's penis that he got a pipe cleaner stuck in. Not sure if he was doing a Mr. Fix-It for erectile problems or he had something in his urethra he was trying to clean out. Greatest career regret that I didn't make a copy of that. Doctors of Reddit. What is the weirdest thing a patient wouldn't admit? Not a doctor, but this happened to my friend. My friend was in a really awful car accident. She was hit head on by a huge pickup truck that was going 83 miles per hour in a 40 mile per hour zone. The driver had passed out at the wheel. When police arrived at the scene, my friend had a punctured lung and several broken ribs. The other driver was unscathed and still passed out at the wheel. The police found open alcohol containers, marijuana, and other illegal substances in his vehicle. He didn't wake up until the ambulance had already arrived at the hospital and he was inside. The doctors, who had been informed that he was under the influence, asked him if he remembered anything. He told them, "I have low blood sugar. I must have passed out." And then they did a drug test and found he had been using everything they found in his car. Real late here, but I am a nurse and we just had a patient, mid-50s male, strictly pooped in diapers. When asked why, he said so he can freeze them. Ends up he has a deep freezer in the garage full of poopy diapers. He also works for housekeeping in the hospital. A few years ago I had one kid, maybe 16 or 17, who evidently had heard of a challenge where you can fully insert a light bulb into your mouth. But when you try to pull it out you can't open your jaw wide enough and the bulb shatters inside. Well, after about 3 hours of picking glass from out of his mouth, in every spot imaginable, gums, under the tongue, roof of the mouth, throat, etc., I asked what went down and he just would not admit that he put the light bulb in his mouth. His main story was that his friend must have slipped it in his mouth when he was sleeping and punched him in the jaw. However, upon talking to this friend in another room, he confessed that the boy had tried to beat the challenge. His friend even showed me videos of other people trying it. So I go back in with the patient and bring his guardians in this case an aunt and uncle, and explained the whole light bulb challenge without giving his friend up. When asked what I was talking about, I explained and said there are many videos on the internet about the exact thing I'm talking about. They also revealed that he had tried several dangerous stunts and challenges before, but even still the stubborn bastard wouldn't admit a thing. He was adamant that he had absolutely no part in his injury and that everyone was out to get him. It's just crazy to me how arrogant and thick-headed some people will get. They'll do anything before admitting to doing something that's stupid and short-sighted. Not the doctor, but patient. Doctor asked me during a physical when my last test for gonorrhea and chlamydia was, and never asked whether I've been sexually active. I'm a virgin. My doctor was cute, and for some reason I felt embarrassed to admit I haven't had sex, so just rolled with the recommended urine test. $250 plus and the expected negative results later. I felt really stupid. Looking back, pretty weird thing to not just admit. My doctor couldn't care less what my sex life was like. Would have saved me some money. Yikes. So in my story, I am actually the patient not telling the doctor something, but I felt like it was good edort and relevant enough to share. But when I was like 13 or so, I ended up with a urinary tract infection, which was odd because I am a guy. I ended up having to go to the children's hospital and had to go through all this stuff to try and look at it and fix it and whatever doctors do for a UT. What I didn't tell them, and still haven't told anyone except my wife, was that this happened because I was curious what it would feel like to shoot water up my dong with a hotel shampoo bottle. Not great, but if you pump air up there it makes a mini fart sound when it comes out, so I guess that's a plus. Hey man, 13-year-old me used the pressure washer setting on a shower head to shoot water up my penis. It would cause the most intense orgasms I have had to date and would last as long as I held it there, so often several minutes. Blood in my urine was a bit of a turn off though. Usually don't mention it because I am afraid some dummy will try it, but I will assume you have the sense not to. Not a doctor, yet, but was volunteering in the emerg ward and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. I'm vet student. Many clients like to say I don't overfeed my dog cat. That's just their normal size when their pet looks like a watermelon. I had a patient who came with his boyfriend. He had severe abdominal pain. He claimed it started when he had a difficult poo. Tests showed he'd ruptured his colon and it turned out it had happened using toys during sex. To me it's weird because he'd introduced me to his boyfriend, so it's not like he needed to hide his sexuality. Pretty sure it's more likely hiding the size of his bad dragon. I'm a doctor of dental medicine. You all freaking lie to me about flossing. One guy who swore he didn't know why he was losing his teeth because he was brushing twice a day caused me to get heated. I have him a mirror, scrapped a chunk of plaque off his teeth from his gum line and showed him a big heaping pile of plaque proving that he was not brushing. I gave him the benefit of the doubt and told him I would show him how to brush, and he turned it down because that couldn't possibly be it. Some people just want dentures as fast as possible. Kind of the opposite situation, but I had to go to the ER because I couldn't keep anything down and I was dehydrated. Doctor asks if it's possible that I'm pregnant and I said I am sexually active, but I just finished my period, so it was unlikely. She just stared at me for a second and starting laughing. Apparently no one ever just admits they have sex and always tried to hide it, for some reason. Turns out I had a kidney infection anyways, lol. I went into the ER because I was 8 weeks pregnant and bleeding with lots of pain. Was worried about an ectopic. Got asked what my chief complaint was. Described the above. Then got asked if I was sexually active recently in the same conversation as they were filling out their info. I was so confused, as if they didn't just hear me worrying about ectopic pregnancy. Starting residency this week. I posted a while back but will post it here again. It wasn't super obvious at first, but after looking into her records it became clear. So this happened on my psychiatry rotation in medical school. Not currently in a psychiatry residency though. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Maybe she just knew your Reddit username. FNP here. Had a first job out of school doing Medicaid risk assessment for insurance companies. I basically had to do complete family social extensive reviews and complete pay and head to toe and make any new preliminary DX and referrals for the insurance company in 60 minutes. Very taxing, but it definitely helped me hone down my skills in getting information from I have this one patient, and doing my thing getting their family history, etc, and get to drugs and alcohol use. Normally pretty good disclosure about obvious things, especially if they are being treated for things like alcoholism etc. I get to smoking history and expect to hear 20 ppd for 15 years given the smell in the house and the opened blunt on the table that was pretty clearly going to be rolled before I arrived. Deadass woman with a 10-month-old on her lap looks me in the eye and says no to any and all smoking history. I stop and look at her in the eye and say, are you absolutely sure? What's this? Points to cigar blunt opened. Yay, that's not mine. You live with a SO at all or roommates? Number. Oh okay. I had gone over myself imposed time limit on that charting section, so I just wrote down no in the chart and had her DX and referred for tobacco and drug abuse. I wasn't about to argue with a woman who couldn't admit an issue so clearly right in both our faces. Radiologist here. I've seen lots of weird things, but the weirdest someone wouldn't admit was the trauma patient. Female, who got pan scanned because she was altered. I saw a cube of gas and debris in her vagina which did not look like a tampon normally would. After some thinking I figured it was either some drugs she was trying to hide or potentially some weird foreign body. I advised the trauma team to investigate. They were not comfortable, so they consulted the jinns. They sent a first-year resident who asked the patient if she had anything in her vagina. The patient denied anything. The GINs reported back to trauma, who reported back to me that she denied anything there. I advised a direct visual examination, which occurred finally an hour later, at which time they found nothing. To this day I have no doubt she had a leprechaun in there. TLDR, don't send a first year resident to do uncomfortable things without explicit instructions. That they had maggots in their foot wound. Patient with diabetes came in to see me in clinic. Said foot had a wound. I asked when they last looked at it. They said that morning, and this was an 11 AM appointment. Helped them take off their sock. There were 4 maggots busily cleaning a pretty large ulcer on the side of the foot. I threw up a little in my mouth and proceeded to remove the maggots and dress the wound. A dang clean wound due to those maggots. Larvae therapy is really effective. We use it in the hospital. Med student. Went to see a patient for my practice physical. These are all volunteers and we don't get charts or anything, just a slip of paper with their name and chief complaint. I walk into the room and this older gentleman is holding his cup of coffee and didn't shake my hand, which threw me off guard. Then I noticed one of his hands was much weaker and kind of scrunched up and he didn't move it. So I asked him about it and he was like, "Nah, it's fine." See, and proceeded to move it like a 1/2 inch. It clearly was not fine. I'm sweating now cause these are mainly just opportunities to talk with patients and they're supposed to be a breeze, but this guy looks like he had a stroke and had no idea. Turns out he was just messing with me, but I was ready to call in a real doctor cause I was freaking the frick out. Optician here. A few days ago a man called asking if he could see an optometrist ASAP. I told him we had no spots left and asked him what seemed to be the problem. He told me he felt he had an eye infection and it's been 4 days since he can't see properly from his left eye. Sometimes clients can complain from over-tearing or swollen eyelids, but no. He told me part of his field of vision was off for the past 4 days. We have indicators, such as flashes of light or dark spots, that tell us if we are dealing with an emergency worthy of being sent directly to the hospital for emergency intervention from the ophthalmology department, and this was clearly it. I told him he has to go to the emergency room now. He tells me he has a busy shift at work and is a supervisor. I told him again to go to the hospital ASAP and to take it seriously. He tells me that he can't because his day will be scrapped. I told him to stop putting work over health and that this needed to be dealt with now. He still argues with me and tells me that he doesn't feel like waiting in the emergency room for hours. In any case, if you have symptoms resembling a retinal detachment, you are seen almost immediately. I insist that he must go. He then tells me I'll go after my day's shift. I tell him to cut it out and go. He then asks me if it's an emergency and to tell him what he has. Given that I'm not allowed to give any diagnosis by the phone, I told him to hurry to the hospital. He told me he would, and I'm pretty sure he stuck to his plan of finishing the day. Retinal detachment can usually be treated if noticed quickly. Not a doctor, but I work in a big, busy hospital. We had a 20-ish-year-old obese woman come in complaining of severe abdominal pain. Before she was even examined, it became clear that she was about to give birth. Side note, my hospital does not have labor and delivery, that is at our other campus a couple of miles away. This woman proceeded to give birth to a full-term 8 pounds healthy boy in hour and denied that she was pregnant and denied that the baby was hers. The placenta was still in her umbilical cord, not cut. The doctor said it's a boy and she said that's not my baby MK. Needless to say, psych was called along with a team from the other hospital to take the baby over to their campus. I often wonder about that baby and hope he is doing okay. Hopefully the mom put him up for adoption and he ended up with some great parents. Maybe not so weird because the person was whacked out of their mind, but once had a patient who was clearly on drugs and vehemently denying it. I'm not a doc, but I'm a lab tech and draw blood in the ED regularly. While I was drawing their blood, the patient was screaming at me to stop letting the green men that were coming out of my arm touch them. Turns out, they were tripping balls, but underage and refused to tell us anything for fear of their parents finding out. Patients lie about the most mundane things. They will tell you they don't smoke cigarettes when you can smell it all over them. You can see a pack in their purse, and you physically saw them smoking outside before they came in for their appointment. That's not what annoys me though. What annoys me most is that patients will Google what they think is their diagnosis, admit they did, get their diagnosis right, then argue with you about the recommended treatment and deny having read that also. The classic example is bronchitis. Patients will Google it, read the Wikipedia article, then still come in and demand antibiotics. When you confront them with this, they will pretend they didn't know that they read that antibiotics do not work. They do this with almost any disease in which the treatment is conservative management, and yet they will still come in asking for treatment that has no evidence. If you're going to become an internet expert, don't do it 50% and deny you didn't read the part about treatment. I work in pharmacy and so many people come in bitching that their doctor didn't give them antibiotics for some that doesn't need antibiotics, and it drives me nuts. For once a doctor has done the right thing, because way too often they just give them to shut the patient up, and now they are getting bad-mouthed for actually doing their job. Needed to do a drug test on a patient who came in with his pregnant girlfriend. Guy goes into the bathroom. A few minutes later he comes back out with an empty cup. He goes back to his room to drink some water. Couple minutes later he hurries back over to the bathroom with a noticeable bulge in his pants pocket. He comes back out with an adequate sample. So, we run the test. It comes back negative. We then run a pregnancy test on the sample. That comes back positive. Dude denied his pregnant girlfriend provided the sample even after being told they can possibly have prostate cancer if his urine turns positive on a pregnancy test. It was unbelievable. I am a doctor. Not a single random thing up my butt is weird to me anymore. I've heard or seen it all. Nor is it that surprising when somebody is wacko enough to claim they got Lyme disease sexually from their husband, who got it vertically from his mother, and that's why they are sterile. If you aren't aware, this is bonkers. The actual weirdest thing for me was that one time when a severely obese person just refused to admit they ate anything but one small salad a day. It just comes down to math. You cannot get up to 500 pounds unless you put 500 pounds of stuff into you at a decent pace. Plus we found a snack wrapper in the inaccessible folds of your pants. Jeebus. I'm a medical coder and for some reason the word panis always makes me giggle. I don't know why, I just think it's one of the funniest sounding medical terms. Patient refusing to admit he is continuing to drink water despite being on fluid restriction for congestive heart failure. He would take a rag, soak up a bunch of water, put it on his forehead as if to cool down, and then squeeze the water out so it would run down his face and into his mouth. Doc, I just don't understand why my weight won't go down. This is water weight we were monitoring, not fat weight. In a heart failure patient, you try to find a weight at which her heart function is optimized, and then aim for this weight, which over the short term of a couple days, is largely reflective of the amount of fluid water in the patient. Very odd. We wondered if it was almost subconscious. Not a doctor but a nurse. I had a patient that kept giving herself chlamydia repeatedly from using her vibrator once she'd been initially infected with it from a random partner. We asked her about any other partners and toys etc. She denied until she couldn't anymore. I first got on this Reddit post 5 hours ago. Somehow I ended up down the Reddit hole reading about CM roaches, Jolly Rancher gonorrhea, squid masturbation, etc. God help me. A patient came in due to abdominal pain. Though we're thorough in our examinations, some parts are omitted for obvious reasons. One doesn't check teeth for abdominal pain, or check one's balls for a complaint of edema. Initial consideration was appendicitis. A few hours later, the patient's wife came up to me and whispered, "My husband is feeling a little timid to mention this, but he feels that one of his testes is a little bit sore." I went to take a look and his balls were swollen to the size of a grapefruit. Turns out the patient had an incarcerated hernia affecting his lymphatics leading to third spacing. That dude was taken straight to the OR. I'm not a doctor but I work in the hospital. We have a regular at the air. She comes every single day. She figured out that we can't send her home before a doctor examines her if she complains of trouble breathing or chest pains. So she always does this. No ward wants her to come there and no doctor wants to be responsible. She's super manipulative, treats the nurses horribly and is very demanding. She is a opioid and benzo addict and usually wants more drugs and someone to take care of her like she's at the Hilton. Her goal every visit is to get admitted. She succeeded a few days ago when there was some issue, self-inflicted, with her colostomy bag. To avoid being sent home, she smeared crap in her IV trying to cause sepsis, just to stay at the ward. Had a 20-ish guy in the ED come in with excruciating chest pain and looked very uncomfortable. Denied any kind of trauma. Turned out he had a fractured sternum. When I told him we figured out why he was having pain, he said, "Oh yeah, I forgot I overdosed yesterday and my friend gave me CPR." Patient came in with an irritated ostomy. Turned out to be an STI. She refused to admit she was using the hole for any sexual activity. This is the second one of these in the thread. Freaking nasty, I guess literally. That they can't afford their meds, yep, America. It's so weird, we can for sure tell you weren't taking them. It's put your life in serious danger, and if you don't fess up it could kick you off the transplant list for non-compliance. It's such a taboo, I guess, to say you're poor. You had to pick lights or meds, food or meds, gas or meds. It sounds so simple, doc, I just couldn't afford that and food, but it takes some work sometimes to get people to just tell us. It's amazing how many patients receive Narcan, but have never used opiates. Narcan only reverses opiates, no other class of medications. They come in with shallow, infrequent respirations, pinpoint pupils, and sometimes needles and H or pills in their pockets. We Narcan them. They wake up, then deny everything. Denial is also a heck of a drug. The drugs in their pockets are never theirs. Sometimes, they are not even their pants. They walked outside pantless, found a pair of pants in their size, never checked the pockets, ended up not using opiates, received Narcan, and those pants somehow happened to have H in them. Amazing. Also had someone walk in with a bullet in their butt, adamantly deny there was a bullet in their butt and they weren't shot. Not a doctor but work in a radiology clinic. People always lie about having fasted for their appointments. They'll come in for their abdominal ultrasound and say they haven't eaten. You are literally holding a bag of McDonald's, sir. We had a guy at the VA hospital in urology who complained of a white urethral discharge. Had many tests, we couldn't figure it out. Multiple visits later, he was admitted due to urinary obstruction. It turned out he was squeezing toothpaste into his urethra. Not a doctor but friend of a patient. I had found her in the bathroom after an attempted suicide. When I found her, she was drifting in and out of consciousness. En route to the hospital, I had called her parents letting them know about the situation, and to my disbelief, they wanted me to lie and say that she had forgotten that she had taken too many pills and that's why she was non-responsive. I refused to do so, but by the time I arrived at the hospital, they were already there and were the ones who gave an account to the Tridge about what had happened. In the air, I lied and said that I needed to use the restroom before flagging down her attending and telling him what had actually happened. Not that I had actually needed to do so, because the doctor wasn't an idiot and knew what had happened by just one look at my friend. A referral was made to a pediatrist, and by the time my friend was fully conscious again, she was sent to a psychiatric facility for monitoring and treatment. A suicide attempt is a suicide attempt. Why lie about it? Whilst I was working in general surgery, we had a 14-year-old kid come in with a small bowel obstruction. The x-ray showed this huge circular object in his bowel and we just couldn't work out what it could be, so he went in for open surgery to take it out. When we opened him up, we found a fully intact water balloon, filled up and tied. When he woke up, when we asked him why he ate it, he said he didn't remember eating a water balloon. No idea how you could forget it though. There's a few references to a recent bug eater. Can someone link that post? When I used to work in a Navy, we had a woman who came in complaining of abdominal pain. She'd only speak to the nurse, and I soon wheeled her over to radiology to get films of an obstruction. No one was given any information beyond that. I soon found out why. The rad tech took a couple of shots and we saw it. She lost a phallic-shaped object up there. When partaking in anal play, use toys with either a bigger base than the toy or some other type of retrieval method. She tried a few shots, but couldn't get a really good image of it. Finally, after the third shot, the rad tech stomped into the room and said, "It's still on, isn't it?" It was 3 AM. The tech had worked all day and was woken up to take the films. Was it Ted's mom who said nothing good ever happens after 2 AM? The patient sat up as straight as she could, held her head high, and said, "I have no idea what you're talking about. How I finished that shift without passing out laughing." I'll never know. Not a doctor, but I work with people occasionally in a hospital for other reasons. Criminals. Anyhow, one day I was sent to pick up a woman for transport to a different facility, and she was being treated a host of different things. She has complained of a lot of pain in the area where her colostomy bag was attached. I believe it's called a stoma. Again, not a doctor. Long story short, she was diagnosed with a host of things wrong with the stoma, and the doctors were all guessing how the heck she had gotten some of those complications. She eventually admitted to me and the rest of the room that she was still engaging in her lifestyle of a prostitute, and men would pay extra money to make sweet love to the hole where her colostomy bag attached. TLDR. For enough money you can make love to the hole in the side of someone's abdomen. Just glove up so you don't give her an STD there. She was making some money on the side. I'll see myself out. I'm an RN, but I've had patients lie about not pooping because they are worried about a suppository. I make sure to go full worst case scenario about bowel obstructions, impaction, emergency surgery, etc. It normally makes them follow my directions, take doctor ordered bowel meds, order certain foods, drink fluid, walk if able, etc. and scares the crap out of them. Not my story, but a fellow co-worker's story. This 360 pounds woman came in, well, wheeled in as she was in a wheelchair since walking was so difficult due to her weight, complaining of severe stomach pain and itching. They took her in and started examining and asking questions. As she's talking about the area that's in pain, they lift up a heavy roll of fat and there were 2 Twinkies squished in there, all moldy and almost necrotic smelling. It was apparently there for nearly 2 months. Want to know what was inside those Twinkies? Maggots. Hundreds of them. All of her pain was caused by the maggots trying to burrow in her necrotic skin left untreated. We believe she put the Twinkie there so they would eat the Twinkie and not her necrotic tissue. She denied that she left them there and has never eaten a Twinkie in her life. Kept going on and on about someone had stuffed them there while she was asleep. Apologies if this is not well written, I am quite tipsy and on mobile. With stories like that I understand your use of alcohol as therapy. Not a doctor. Family member is a psychiatrist. Told me that patients won't ask for a new doctor psychiatrist even if they hate them. I mean, come on. This is about you. The doctors probably deal with worse crap a dozen times a day, and you asking for a switch isn't going to make their day that much worse. Maybe even better. Just tell the absolute truth. We caught a mother of a patient injecting poop in his son's veins. She obviously denied she could do so because her and his son were well known in the hospital, so she gained the trust of the nurses. She was arrested and diagnosed with Munchausen syndrome by proxy. The poor baby is alive but with development problems. Volunteering as an RSO and medic during my local range club's open weekend. Dumbass rested the barrel of a 10-22 on the toe of his boot for a picture and shot himself in the foot. Claimed it was a sniper. I told him that the entry wound was straight through the top of his boot and asked him where shot came from. They must have a stealth chopper. We need to call the cops. You were inside when it happened. I saw you do it. Fellas, don't do bath salt. I had a patient who came in for a corneal abrasion from getting crack in his eye, was still holding the crack pipe, and claimed that he didn't smoke crack. Not a doctor but work in a psych hospital. Walked into a patient's bathroom at 3 AM. BC he was in there for a suspiciously long time. To find crap smeared literally everywhere, and he's standing there butt naked staring at me. He swears up and down he has no idea how it got there, and he was just as surprised as I was. I just turned, walked out, called a violent code team to come hose him down, and called the EVS team, environmental services, to come scrub and sanitize the bathroom. But the entire time he's still in full denial he did not do it, even though they literally had to scrape crap out of his fingernails and out of his eyebrows. Called the on-call doctor who ordered him to be a full one observation from then on out, so congrats buddy, you now have to have someone watch you eat, sleep, and crap for the next few weeks. Had a mother bring in her 7-ish-year-old kid who had locked a pair of pink fuzzy handcuffs around his hands. She kept saying he found them on the street, and he would get mad and say, "I told you mom I found them in your room," and she would just completely ignore that. Serious, doctors and therapists of Reddit, have you ever been glad that a patient stopped coming to you? What happened? Orthopedic surgeon here. Best, worst. Patient shows up for elective surgery munching on a big cup of ice. Big nope. Tell her we have to reschedule her case. She throws a tantrum. But I have dry mouth and have to chew this ice. I understand, but we can't put you under with a belly full of water, risk of throwing up and sucking all that stomach goo into your lungs and dying. Go back and forth like this for a few minutes. I say to her, you know, talking to you is like talking to a toddler. She didn't like that at all. Finally tell her to go home and I'll leave the pre-op area. A few minutes later the nurse finds me and says, Ms. Pain in the butt won't leave. She says she doesn't have a ride home. I give the nurse $20 to call her a cab. To this day still the best use of a 20 ever. Never heard from her again. I had a patient that I saw quite often for a number of simple illnesses. She would often joke that she came in just because I was working the clinic that day, said she would check if my vehicle was outside. Over the course of several months I noticed she was coming in more often and with less clothing on. Short skirts, low cut tops. Last straw was her coming in with a loose fitting shirt and no bra. I fired her as a patient after that. That's actually smart. You can lose your license if you fool around with a patient. Yes, but almost exclusively patients that are seeking controlled substances that I don't believe are indicated for their condition. I've never fired a patient, but I've definitely have patients that don't appreciate my attempts to wean them off their chronic opioids. Many patients with chronic pain are happy to try my suggestions. However, for those that aren't interested in reducing their dependence on these medications, I don't think I'm a great fit as their doctor. In my homeland, I used to run an outpatient clinic together with several other GPs. The patients can freely choose which doctor they want to visit, or if they're regular patients, to change doctor if they want. Somehow, I was always stuck with annoying patients, like those who were over-demanding, tried to steer the doctors on what to examine and what to prescribe, impossibly uncooperative or non-compliant, hard-headed and in complete denial, like to argue back, all you can name it. Most of them are also doctor shoppers and like to boast about that, a clear red flag. Usually, most doctors would try to be sugarly sweet and nice and suck up to these patients no matter what, but I just couldn't. I treated them like any other patients. Yes means yes and no means no. We can discuss the medications and course of examinations, but you can't steer me around like a car and have it all your way as you please. Most of these difficult patients were often displeased and somewhat crossed by my policy, yet they keep returning to me, despite me giving very clear sign I'm never going to treat they specially or give in to their demand. Eventually, after several consultation, a lot of them would never return, which was completely expected from their doctor shopping behavior. I always feel a lot relieved while wondering why they didn't go away sooner. Even my colleagues and nurses often joked whenever a new difficult patient came, saying my calling had come. I used to practice in a clinical situation where most of my patients were older or elderly. It didn't happen often, but the patients that I would always dread seeing were the ones who were starting to lose cognitive skills and memory abilities, but had absolutely nobody else I was legally authorized to speak about their care with. Spouse was deceased, no kids or kids were estranged, etc. Appointments could often turn into he said she said, so it would take me forever to write reports for those patients because I essentially had to include every word said by either of us into the report to document that I told them something, for when they inevitably returned later on complaining that I never told them that exact thing. I'd never wish anyone harm, but I did occasionally find myself searching local obituaries when I'd realize I hadn't seen certain patients like that in a while, in the hopes that maybe I wouldn't have to. Pro tip: the mean ones never die. My great grandma went this way a while back once the family dumped her in a home. She passed this week, but spite fueled her for 108 solid years. Totally mundane anecdote. Had a person who insisted on regular contact. No cost to them. They received general support from our service but wanted a regular appointment with psychologist. Didn't really have a purpose other than a general chat. Basically just encouraged spacing out appointments, and then at some point they just decided they couldn't be bothered walking in. It's kind of surprising how draining it is to have a benign but knowingly unuseful appointment on the regular. A couple of years after becoming an attending surgeon, I had this miserably pessimistic patient with mostly problems related to self-neglect. She was agoraphobic, barely left her house, and a glutton for misery, basically refusing to do anything that might better her circumstance. She came to see me because she had a gastric bypass somewhere else in the past and wanted continuity of care. One day she hands me an envelope and tells me I've been served and that she's sorry her husband the process server couldn't ever catch me at home because I work too much. It's true. I was working quite a lot because my wife of 12 years was being insufferable since we had moved away from her best friend in Miami for an incredibly better quality of life and work situation. Anyways, there were divorce papers and my wife was leaving me to marry her friend's brother, which I was already anticipating. It worked out well because then I was free to start over fresh with someone who shared my current priorities. Now we have 3 kids and a great life of rewarding work for only half days, frequent travel and leisure, and 3 awesome young children. The miserable patient didn't feel comfortable having me as her provider after that, even though I offered to continue to do so. Huge win on all counts. Sure, sometimes it's just not a good fit and that's a relief. The one I recall the most relief around worked hard to blame me for her lack of attendance and no showing, going as far as to scream at me on the phone and accuse me of lying after I had been crystal clear regarding my boundaries and attendance expectations. She was not ready for therapy in the way I was able to provide it. She came back to the clinic later and saw someone else and did a lot better. I felt for her, but I'm not putting up with that. Honestly, it's way more often that I think fondly of the amazing people I've been honored to work with, wonder how they are doing, and wish them well in my mind. My job is truly a gift. Tons of times, the whole department was glad when a certain rude PT's insurance changed. They recently switched back because of course they did. We're awesome. But the nurse who dealt the most with them cried and said she couldn't do that again. Nothing that stands out to Reddit. Standard threaten everyone's jobs and safety, everything they come and be demanding to an absurd degree and take 1+ hours of our time for a 20-minute apt slot and threaten to call the director if we didn't bend over backwards. But points like that one are frankly common. You just don't quite see them every few weeks for benign chronic conditions that can be managed with a yearly follow-up. Another person was disgusted that we wouldn't see them for free after they realized they had to pay a copay to see us and acted like it was our problem to fix. Doctor stuck by her guns and the lady failed filing a complaint with the medical board for us telling her to pay her part. Neither a doctor or therapist, but I am a manager at laser hair removal clinic which also does chemical peels. We had this one client who we will call Dumby, DB, so she would come to use for treatment for laser and go to one of our therapists. Now typically our clients will always see the same therapist for consistency, but this time we couldn't. After the treatment, she complimented our therapist and then when our therapist left, DB said to our receptionist that she was terrible and wants to see someone else. Okay cool, so we booked her in with the next therapist and during her treatment, she just starts bitching about her previous one. Comes out and compliments our therapist, then asks to see a different one. Like what? She then starts bitching to the next therapist about the previous 2. She did the same pattern through all 5 of our therapists and then goes back to her original and B about the other therapists and says you're the only one I like. The others are just horrible and you're the nice one. Now she said some very racist and harsh remarks during her bitching, so I had to talk to her about it and tell her that we cannot treat her anymore. She called us all C and then had a nerve to call us up for a refund which was declined. Friend of my parents who is a therapist told me this story when I asked her about how she coped with her patient's suffering. She told me that there was one patient she had and wished she would never have met, through no fault of his own, though she wouldn't give me much detail of course, but this is the gist of the story. She had a patient who came to counseling after decades of trying to cope with his childhood on his own and failing. It took quite some time for him to finally be able to tell her how he had been terribly abused as a kid. He proceeded to tell her about all the horrific things that had been done to him. It was absolutely terrifying and heartbreaking that anyone could go through this, and according to my parents' friend it was surprising he even could survive. The horrors the patient described made a lasting impression on his therapist and started messing with her badly for some reason. She was not used to treat trauma of this kind and it came to a point when she would be reluctant meeting her patient because she knew he would talk about things that frightened her. She didn't want to break his trust. though, and he really needed the therapy, so she said nothing. After a while, however, the patient noticed that he was unwillingly making her uncomfortable and mentioned it in a session. They both agreed that she couldn't help him in these conditions and it would be better if she referred him to colleague. She told me she was quite relieved not having to deal with this patient anymore, but at the same time felt inadequate and unprofessional for being frightened by his pain. I'm a nurse. I've never felt bad about a patient firing me. I have felt bad a couple times about ones that threaten to do so and then change their mind. I love being a nurse, but some people are buttholes. There sure are. There are some buttholes in every job where you interact with humans. TLDR. Highly destructive and violent patient turns out to be a child rapist. Thank God he's gone. I work at an assisted living facility. The floor I work on is basically a high-functioning inpatient geropsych. Had a patient who would write very long lists detailing how to kill the staff. Things like, I need to find a knife, I will slit their throats, etc. Whenever he wasn't writing lists, he would pace back and forth between all of our alarmed doors. Try to open them and shove them when the alarm went off. When you do that, a very loud piercing alarm goes off and the radios stop putting out any message but elopement, second floor west stairway, over and over. This was hundreds of times a day. He would attack anyone who came near him, especially staff. It was getting bad. Broke all the picture frame, smashed our flat screen TV in the common area into the ground, smashed the tables, windows, doors, anything he could touch, just constant crap. His niece went to his house where he lived with his 2 brothers. Floor to ceiling child pornography. A lot of it they recorded themselves, some dating back to the early 70s. So yeah, I was happy to see him be arrested. I feel terrible saying it, but anyone with a personality disorder, especially cluster B, ETA, I should say that I am doing inpatient psychiatry right now, and you can't really do anything effective with people who suffer from personality disorders in less than 5 days. Outpatient is a completely different story. As someone with BPD, I sincerely apologize. At least some of are conscious of the cringy, hurtful, dramatic crap we do. Some of us really are there seeking change. As for the rest of us, I've met them too and I agree. Unrealistic expectations. Expectation management is a real thing, and I have had patients come to me demanding the guaranteed investigation procedure that will solve their problems that they were promised earlier in their referral pathway or from some internet forum. Usually education with relevant facts clear things up, but it eats into the next patient's waiting time, and that is one reason why clinics overrun. I remember being particularly relieved but felt sorry for a patient who kept coming back with alternative treatments for his very curable cancer despite attempts to educate and support him on the merits of modern medicine. Eventually he went elsewhere, presumably to try and find someone who would give him the answers he wanted to hear. When I had my foot surgery, I couldn't help but notice how all the people at the orthopedic practice I went to acted as if I was some sort of celebrity every time I visited. Then I looked around at the patients in the waiting room one day. Of the people there, the only people who looked like they were under 60 years old were my mother and I. She and I figure that probably most of their regular patients don't really get better. Unlike them, I was a success story. So the reason the doctor's assistants always smiled and waved at me was because I had a real chance of not coming back to them for a long time. It was really sad and kind of sobering. So my mother is the difficult patient. She has a personality disorder and on top of that, is genuinely afraid of the doctor. It's not a good combo. It tends to bring out the worsts in her. I try to be at the doctor's with her when I can, to help ease the tension for both the medical professionals and her, but I can't always be. I've really deeply appreciated the people who were exceptionally patient and kind to her. Not saying I might not react similarly when faced with difficult people, but it does make me sad reading some of these stories about medical professionals telling off patients. It's easy to be nice to nice people, but what really shows true character for me is when someone is nice to a truly difficult person. Mental illness sucks and isn't always so obvious as someone murmuring to themselves and like munching on their arm. Although if they threaten you, are sexist or racist towards you, etc., you def have the right to defend yourself, no matter their mental stability. I did peer support and residential support specialist stuff, so not a therapist or anything, but I had one client who was severely symptomatic. Heard voices a lot and would argue loudly with them. Would hurt themselves for attention. Had awful boundary issues with other clients that borderline stalking. Was reprimanded multiple times for bouts of sexual harassment towards other clients. Didn't like to shower and believed that when bath water turned black it was toxins leaving your body and not just because they were that dirty. I truly hope this person found the help they needed and the right therapy though. Doctors of Reddit. What was the most shocking case of "oh I thought that was normal" you've seen in a patient? Patient here. I spent the majority of my life thinking it was normal to lose muscle control when laughing really hard or scared. I used to tell my friends to stop making me laugh in high school while I was taking notes since I couldn't hold the pencil anymore. Turns out I have cataplexy, which is a weird sleep disorder that causes it. Apparently falling over when someone startles you is not something everyone experiences. My friend is being told that vomiting blood during pregnancy is normal and doc gives her a med and tells her to go home. Same with some other freaky symptoms. I've never heard of that. I think she needs a new obgyn. Good god yes. Get a new doctor. Vomiting blood is never normal. Not a doctor, but I went to visit a friend of mine whom I hadn't seen in over a year. 6 feet 4 inches buff dude who ran 10 miles a day had dropped to 135 pounds and I dragged him into the hospital after he said he was having trouble with keeping food in his system for very long and thought it was normal because he'd always had some digestive issues. Ulcerative colitis, lost a massive chunk of his gut, was on IV nutrition for months, and had to be very carefully monitored because he also ended up with a nasty case of refeeding syndrome. Dentist here. Did scaling of a patient and these huge chunks of calculus came out, and this patient proceeded to say that a dentist from the endodontics department referred him here for scaling that he didn't need. I showed him the chunks of calculus and this patient replies with "oh I thought this stuff was there to strengthen my teeth." My older sister had a tick in her leg for 4 months. I noticed it at one point because she had drawn doodles around it with a pen. She was an adult at the time. These stories are actually a dime a dozen. It's kind of baffling. Admitted a guy last week who came to the ED with chief complaint of some right-sided numbness for last few days, presumably had a stroke. Turns out he also had a rapidly progressing gangrenous infection of his scrotum, thighs, perirectal areas which required emergency surgery. He wouldn't have even sought out medical attention if it wasn't for his stroke. Also had a patient not even mention that he had been paralyzed from the waist down for the last week, which was new for him. Never even mentioned it. Did complain about his nausea though. As a patient, some of these are on me, some are on the medical professionals, but pretty understandable. Some both. Went in for ongoing issues with generally feeling unwell. Doc said I probably had pneumonia, and when I asked about my toe hurting he said, "Probably just broken. Nothing we can do." Next morning my leg was 3x its normal size and I went into septic shock and had a seizure. They never figured out the pathogen, but I had cellulitis in my leg. In spite of being in the hospital a week I still had no idea anything serious had happened. Never heard of sepsis except regarding menstruation. Until a doctor came in, looked at my leg and said, "I don't think we'll have to amputate anything." Afterwards, learning the drugs they gave me, I realized I had come pretty close to dying. Another time I started hallucinating while totally sober and in fine health. I thought it was a little funny but no big deal. Once it stopped I was sort of on the fence on whether to do anything, so I called my parents' doctor's office and spoke to the nurse. She said I should probably go in just to be safe. I really didn't want to deal with the costs. She asked if I had anything else wrong. I kinda laughed and said, "Nah, I mean I woke up with a sore neck, but that's life." She told me to go immediately to the ER. I had had a stroke. One other time I got food poisoning. I'd never had serious food poisoning before, but my boss who I was at a conference with had. After clearing myself completely in a very short period of time, I told her I would probably miss the next day. She asked if I needed anything. I said, "No number. I'm just trying to drink water but I can't keep it down. I've put all my pillows on the bathroom floor so I can stay close to the toilet." She brought me ginger tea and asked if they could take me to the hospital. I declined and tried the tea, which also came back up. I was still heaving and got to the point I could hardly get up, so I let her and a co-worker drive me to the hospital, but I felt so stupid. Who goes to the ER for food poisoning? They stabilized me in the ER after a few hours and ran some tests. They told me then I could go home if I wanted, or stay the night in the hospital if I preferred. If you can't tell, I'm really the sort to not worry about health and assume things will be fine. But some instinct told me to stay. I felt like crap when they wheeled me over to the hospital and I told them that. Next thing I remember, I was on a hospital bed surrounded by med staff. I had a seizure. Fremulin. As a patient, I've always had headaches, almost daily. About 10 years ago, I started seeing weird auras that would take up my whole vision, and then get a terrible headache that made me want to die. Maybe once a year that would happen. About 3 years ago, we got really good insurance. Then I got several auras right in a row, and I start to worry it's a detached retina or something. So I go and see an ophthalmologist, who dilated my eyes and looked around. He suggested I see a neurologist, and maybe they'll do an MRI. Meanwhile, I had a stomachache that lasted a few days. Very odd for me, since I don't really get them. But it woke me up in the middle of the night one day, and I had another aura visual, but no headache. Saw the neurologist a week later, and boy did he like talking about how fat I was. I had 3 kids in their years. I'm squishy, not morbidly obese with little motion. Deal with it. They were able to get me in for the MRI that day, and despite being claustrophobic, it wasn't terrible. I walked out to the parking lot, and they called me and asked me to come back in. When I got in, she told me I'd had a stroke, and they needed to admit me to the ER. The office was at the hospital already, so she literally just walked me through like 2 doors, and I didn't even have to wait in the lobby. Spent 3 days being poked and prodded. I never really saw the big deal. It was just a stomachache and dancing lights. I'm doing a lot better now. I'm a receptionist in a GP practice, and we had a patient come in with breast pain. After examination, it was revealed the whole breast was cancerous. She'd hidden it from her husband and had dealt with the pain for 2 whole years because she was embarrassed. It was really sad and made the whole practice cry. I was the patient. I thought it was normal to have a heart rate range of 90-130 BPM. My whole life it's been that way, and none of my doctors had raised any red flags over it. One had me track my heart rate for a week, but nothing came of it. I knew the average was much lower than mine, but I thought that's just how my body worked. I am 23 years old and had a heart attack last month. Just got home from the ordeal yesterday. I was the patient. For years, I thought it was normal to get a UTI every once in a while. Every few years, I'd see blood in my urine. Go to a doctor, different doctors every time thanks to moving around a lot. Have the doctor say, "That's really weird. Guys don't get UTIs very often." Then shrug and give antibiotics. After a few days, it would always go away. Then last November I had the same thing happen, but with way more blood. Went to the urgent care, who immediately told me to go to the ER. Was admitted as soon as I got there, and 2 weeks later I was released, carrying with me a diagnosis for a kidney disease. It turns out that blood appeared every time the filters in my kidneys suffered severe damage. A very seriously heart problem. Exact cause I don't know. I work outpatient and we transferred to hospital, and I never heard about the follow-up. That would be someone else's job. That caused the patient to pass out frequently, sometimes daily, and be extremely winded up a single flight of stairs. Apparently just thought they were overweight and that it was normal. We had to explain that passing out for zero reason is not normal, that you should tell your doctor about it. The problem itself was sort of off and on. I mean, the cause obviously would always be there, but the symptoms came and went, so we didn't even know initially either, because our initial vitals all looked good. Then second set was very not good and none of the meds we had helped, so we ended up sending to hospital. Heart rate was extremely high and pretty sustained period of time, like 45-60 minutes with us. Not sure how long continued, so this patient was passing out because of a lack of oxygen. Heart was beating too fast to properly circulate and oxygenate blood. Apparently had been a problem as long as they could remember, so it was their normal. Never once came up to doctor. The worst part to me is that this had been happening since at least a teen, if not younger, so their parents never brought them to doc or mentioned while there. Patient story. Came off my bike during lunch break at a real slow walking pace after the wheel jammed on a gutter. Went over the bars and had a nasty fosh landing. My right wrist swelled up almost instantly and so I isolated it thinking it was a probable collis fracture and then proceeded to walk the 1.5 kilometers back to the office. In cleats. With carbon fiber shoes that had no flex in the soles. Had to push the bike too. I was in a lot of pain so took myself off to the Alfred for scans. The triage nurse assessed it and came to the same conclusion I did. Was given an ice pack and the doctor came around and ordered X-rays. I was in tears the entire time the films were being done and I don't normally cry either. The only comfort from the radiology tech was there's a reason why you're crying. But I'll leave that to the doctor. Turns out I had sustained bilateral radial head fractures and broken my left wrist. The swelling in my right lower forearm was a reaction to the broken radial head. Spent 8 weeks in akimbo slings and then another 3 months of OT to teach my biceps how to bend my arms again and even now I only have 90% bone strength in those joints. Click like M2 when doing chest presses and it hurts like a bee in the cold. Second time was self-diagnosed appendicitis. Had RLQ pain throughout the day, then felt really poorly by the evening. My brother took me down to the ED and the docs there came to the same conclusion. Had it out the next day. My brother thought I was hamming it up and went off to my parents' house for dinner after dropping me off with the protestation of it turns out to be nothing. You can catch the train home. He came back later that night to be told I was actually spot on with the diagnosis. Boy did he feel crap after that. I was the patient. I have had serious pain when walking for as long as I can remember. I never spoke about it until one day in gym class at school when I was like 8 and was in so much pain I was crying. Turns out I have hydrocephalus. Not a doctor, but a former carer. My father felt a loud pop as I was helping him out of bed. This wasn't unusual and my father thought he just pulled something. However, the pain didn't subside for weeks. I dragged him to the GP and then to the hospital for a scan. The pop turned out to be the back of his rib totally separating as the bone was mostly powder. Lung cancer from smoking as a young adult had grown through the back of his lung and into his ribs and spine. He was in palliative care from then on. At least he got to say goodbye to his cat Tilly. I brought her into the hospital and he let her loaf on his chest with her bum in his face for one last time. Patient here. My pregnancy was really painful. I was the only woman in my family besides my mother, and she never got sick at all while pregnant. I thought it was normal that I couldn't stand straight or go farther than 10 feet from the bathroom, or that I spent days in the bathroom floor unable to keep anything down to the point where I would lose track of days. My fiance finally begged me to go to the ER because of all the pain I had. Turned out I had an acute UTI that was ready to spread to my kidneys. They told me if I waited any longer, I would have miscarried. The thought definitely makes me hold my baby tighter. Anesthesiologist in pain management here. I once had a self-referred patient come in for his first consult. The gentleman was clearly in a full-blown episode of acute pancreatitis and was close to stroking out. I had staff call EMS. Myself and nurses initiated emergency protocols. After getting him somewhat stabilized and pain nausea under control, I asked him why in the heck he hadn't gone to the ER. He said, "Oh, I've had these episodes before and thought it was normal, SMH." My best friend was a patient. She was being diagnosed with hernia and was set to have a surgery a year later or so. Because it wasn't that bad to have an emergency surgery, eventually decided to go to her home country because she felt she was mistreated. She was scheduled to have a pre-surgery checkup and have the surgery 2 weeks later. Well, when she went for the checkup, she got taken to the table without sleeping anesthesia and she was operated there and then. While she could see what's happening, she had some local one. Turned out she had a birth defect that ended up causing a massive cyst to grow. She was in a great danger. She had trouble walking and had to take a flight back the day after. She is doing much better now, but she is diagnosed to have another one on the other side. Coronavirus made it really hard to get another surgery done. My freshman year of college I had a really bad sore throat for a few days. I thought nothing of it and just took a crap ton of Tylenol until it went away. About a month later I noticed the joints in my fingers were extremely sore and I could barely make a fist. Next it was my wrists, elbows, knees, ankles, etc. It reached all my joints and muscles. It even hurt to lift my eyebrows or touch my scalp. I couldn't roll over in bed. I literally just lied in bed for days and cried. Finally my mom, who lived about 4 hours away, came and took me to the doctor, and he diagnosed me with something called post-streptococcal arthritis. Turns out I had strep throat a month prior, and because I didn't treat it with antibiotics, it spread through my body and caused arthritis in literally all of my joints. He prescribed a steroid and painkillers and said good luck. Man, I've had a lot of medical problems in my life, but this one was the worst by far. It took another 3 months for me to start feeling normal again and a full year to be completely back to normal. Now I catch strep throat extremely easily and I get it at least 4-5 times a year. If I don't get it treated within 2 days, the arthritis flares back up again. One night, when I was 16, I had a very sharp pain in my right side. I tossed and turned for a couple hours before getting up and knocking on my mom's bedroom door. A forbidden action. My mother swung the door open and snapped at me, "What did I want?" And when I explained my pain, she told me it was heartburn, to drink some milk and go back to bed. I drank the milk, tossed around my bed for a few more hours, and finally passed out from exhaustion. Next day, I felt fine. A couple months later, the pain was back and I again woke my mother. Same response. I eventually passed out from exhaustion again. The next time I felt the pain, I didn't bother going to my mother and just rode it out. This continued until I was 18. My parents were out of town one weekend and the pain came back worse than ever before, waking me from a dead sleep. After hours and hours of utter agony, hurting to move, hurting to lay still, I broke down and called my mother, leaving her a voicemail that I thought I was dying. I finally passed out as the sun began to rise. I was woken by my uncle banging on the front door and he took me to the doctor, who referred me to an ultrasound office, who had referred me to a surgeon. While I saw the first two the same day, the surgeon didn't have an availability until the end of the week. Didn't think anything of it as, once again, the pain was now gone. Mum begrudgingly takes me to the surgeon appointment, but I'm pretty sure she thought I was faking it since I'd been completely fine all week. I remember sitting in the office with the surgeon, just chatting while we waited for the nurse to bring him my ultrasound file. I'll never forget when she handed it to him. He opened the folder and the smile immediately fell from his face. Surgeon: "Did they give you any pain meds when you went to the doctor?" Me: "No, just some antibiotics." Y.S. To nurse: "Nancy, call my 2 o'clock and tell them we have to reschedule as I'll be in emergency surgery." To me: "You should have been sent to me last week. I'll meet you in the air." So yeah, my gallbladder had apparently been filled with stones since I was 16 and making more still for the last 2 years. The surgeon said he'd never seen anything like it, and my mother told me she overheard some nurses' questions how I was still walking. I guess mother didn't think that her mother having her gallbladder out at 16 and herself having it out at 18 was worth considering when I first woke her with pains in my side. I thought I just had heartburn. Doctor here. In med school I found a snack wrapper buried in the rolls of a really fat patient. This triggered endless stories from the experienced folks. My friend is a nurse and one time a group of us were eating lunch and she decided to tell the story of how she was sponging off a really fat lady, and when she lifted a roll a whole bunch of cockroaches crawled out and you could see where they were, eating her skin. Not a doc, a nurse. Patient tells me it's completely normal for people to stop breathing for a bit when they've taken recreational drugs and that we completely overreacted when we resuscitated them, intubated them, put them on a ventilator for a few days and notified their next of kin to come in because we were concerned about brain damage. According to them, just because they stopped breathing didn't mean they were going to die. This happened last month or so. I had been having this problem for about 2 months. I'd feel some pain or pressure in my chest, specifically in my left lung. If I'd get or bounced a bit or try to take a deep breath, I would normally need to burp, which made the pain disappear, so I thought that I had just swallowed some air or something had gone down the wrong pipe or whatever. Thought it was no big deal. Over time it got worse and worse. I would burp more, pain more frequently. Once or twice per week I would have a splitting pain which made me unable to turn on my left side until it was worse than ever. I couldn't sleep at all and was just tossing and turning. It was a total of 23 hours from when the pain first started and when I notified my mom I might have to go to the ER. Turns out I had a collapsed lung, not partially deflated, completely collapsed bad enough so it was pressing up against my heart and disrupting its rhythm. 2 operations later and 6 days in total I was okay. Through the glory of healthcare the total hospital bill I had to pay was $25. Insurance paid it down from the original $60. Not an MD, but a radiation therapist here. If your wife starts to look like an ash grey skeleton with a pot belly and swollen extremities, then loses her mental faculties until almost catatonic, something is wrong. Don't wait several months. Ovarian tumors the size of slightly underinflated volleyballs, stuffed into her lower abdomen. The CT was textbook worthy. This is the first AskReddit post I have read every comment on. Honestly such an interesting topic. If I wasn't broke I would give you an award. Not a doctor, but I know my friend had always suffered from abdominal pain ever since he was a small child and was just used to it. One day when he was at the doctor chest pain came into the conversation because of something completely unrelated and he found out he had a bifid rib, essentially where a rib splits into 2. Afterwards when he was talking to us he was like, guys, is it not normal to just like have chest pain? Luckily it's nothing lethal. Not a doctor. My buddy was doing a cable service call for a new customer. They were just chatting when the customer explained he had brain surgery recently and pulled off his hat to show the scars. Buddy said he gagged and called 911 immediately. His head was full of maggots and looked like meat left out too long. The customer was elderly and no relatives lived close by to help care for him. He thought the aches were from surgery and ignored it. Not the doc, but the patient. Someone gifted me a free set of adjustments with a chiropractor. I had always been skeptical, but decided to try it out since it was paid for. After the first adjustment, I told the doctor, I didn't even realize my back was hurting. I just thought that's what it felt like after a certain age. Turns out constant throbbing back pain is not normal. Glad to be proven wrong, because it means I can do something about it. It was the first time I haven't had consistent back pain since I was 14. Sports messed my body up from a young age. I thought it was just part of puberty. He erased more than a decade's worth of pain in under 10 minutes. Not a doctor, but I have what's called Hagland's deformities in both my feet. Essentially a bone is growing from the back of my heel through my Achilles tendon. Every time I would run walk even it would rip and tear a bit more and form scar tissue, called a bursa. Now I would only feel the pain after I had finished running, and the only time I was running was when I was playing rugby, so afterwards your whole body tends to hurt. Essentially I had this for close to 20 years and there is a giant lump that protrudes from the back of my heel. I always thought this was normal as I never really looked at anyone else's feet in great detail. When I tore all the ligaments in my knee, the doctor saw the lumps and told me the only way to get rid of them would be cut through my Achilles, grind the bone away and reattach my Achilles. As I would have to learn to walk again, I essentially chose to just stop running. Patient here. I used to get periods so bad I would get dizzy and black out regularly. Father told me that all periods are bad. OB-GYN told me I just didn't have a high pain threshold. 2 years later, my sister has the same symptoms and my mom gets very concerned because that's not normal. I just kinda said it's been happening to me for years. And my mother, sister, and I went to a different doc. Guess who has endometriosis? My mom is an RN and was just telling us about this lady she met while working in the emergency room a few years ago. This lady was morbidly overweight, diabetic and was bedbound. She called 911 because she was worried about a smell coming from her bottom half. Again, she was morbidly obese and could not bend over far enough to see what was going on. Guess she gets seen by a doctor who checks her feet out, which were described as black as a chalkboard and almost completely dead, which was going to result in her losing her feet. When the doctor asked why she didn't have anyone checking in on her, she said that her kids came by once a week to bring her food, but she thought that tingling diabetic pain was normal. Feel bad for her. I remember saying once in college that if my hands hurt this much now, I'm gonna kill myself when I develop arthritis. Turns out, I already had it. I was recently diagnosed with rheumatoid arthritis and hypermobility. The hypermobility is not as severe as EDS. but it's notable. Just this year, I've dislocated a couple fingers, my wrist a few times, and both kneecaps. One was a full dislocation that had me on crutches for a few weeks and constantly subluxed. My doctor thinks the inflammation is new, but that I've been dislocating joints for years. I genuinely thought everyone was in as much constant pain as I was, and that they just managed it better and coped more efficiently. My eyesight deteriorated over a year and a half until my mom got mad at me for being difficult about my homework and I told her it was too blurry. Sad thing is, I was just entering puberty and getting acne, and that year I was the most confident in my appearance out of all my teenage years. I thought everyone couldn't see my acne unless they were 6 inches or less away. Not sure it fits here. I have a ridiculously high pain tolerance. Joke goes that I might lose a couple of limbs and it will take me a while to notice. I had some minor pain around my lower stomach and back. I didn't think of it much. I assumed it was some minor GI issues. Took paracetamol and didn't pay it much thought. This went for several days. Later that week, I suddenly started feeling seriously ill. Cold sweat, chills, fainting. Thought I might have somehow messed up the medications or something. In the end, it took just a couple of tests to figure out I had a severe kidney infection. And considering the severity, it had been going on for at least a month. I only felt minor discomfort for the few last days of it. Patient here. Stepped on a nail at 6 AM. Pulled my foot off the nail and went to school. Walked around all day in flip-flops. Sister made me go to the ER in the afternoon. Foot was all swelled up. Doc said that if I had just gone home like I wanted I would have died in my sleep from the infection. Spent 10 days in the hospital getting IV antibiotics every 4 hours. 5 days of that there were serious conversations about amputation. I'm the patient. Last October, after a wild night, I fell into some bushes by the side of the road. Lack of sobriety definitely a cause, though I wonder if I'd been pushed. Anyway, that wouldn't be so bad except for some reason. The sidewalk I'd been on was elevated by about 1-2 meters from the base of the bushes, and there was a concrete patch. Later I discovered it to be a manhole, right where I landed on my right shoulder. I got up, checked that I had full hand and finger mobility, and I could bend my elbows. I couldn't lift my arm above my head without some pain, but I figured I should be fine. Cleaned myself up, got home and went on with life as normal. The next 2 days it was a bit rough trying to lift my right arm, but after that it was more or less okay. I dismissed it as a muscle strain. 10 days later I pick up and carry my daughter and there's a searing pain at the shoulder where I had fallen. It still wasn't so bad, but since it hadn't gone away after 10 days, I should probably get an x-ray done. I had actually gone to see a doctor who asked me to get one done, but it slipped my mind. So fast forward to the x-ray scan, which was a couple of days after me carrying my daughter, and 12 days after the incident. I hear the x-ray guy say, "Oh, after the first one." Then I hear a muted phone call between him and the doctor I had seen earlier that day, not the same one from first appointment. When I was dressed and came out, x-ray technician bro told me he couldn't believe I'd been walking around for 12 days without pain. My clavicle collarbone was broken. On the right side, the bone was kind of tilted upwards, and it was totally separated from the left. By the time I got surgery to get the collarbone fixed, almost 4 weeks had passed since I fell. TLDR. I fell and broke my collarbone clavicle last October. Didn't realize it till 12 days later, and didn't get surgery until 4 weeks later. I have a reverse situation for you. During my training school for the military, while I would walk downstairs, sometimes pain would shoot down my legs, and they'd get kind of numb. One day, I was walking down the stairs, and lost all sensation in my legs, and just tumbled down the stairs. I naturally went to the hospital, and the military doctor told me it was a normal occurrence, and to be more careful. Not a doctor, I was a patient. I, 14, started getting an upset stomach one night, and it wasn't just another bellyache, maybe a little bit more intense, but I slept through it pretty well. The next morning my parents got me an appointment to the doctors to see if I was okay. We get through it all, but we had to wait at one point. Don't remember when, like before we went to the checkup, after, etc. And I told my mom we should just go home. It's probably nothing. Next thing I know, I need surgery. When talking to the doctor before the surgery, he explained that my appendix had burst and told me I had a very high tolerance to pain and that he was surprised I slept through it. Afterwards, he also explained to me that if I didn't have surgery when I did, I would have died around 1-3 days later. I can see now why a lot of people think that not feeling pain won't be good. Patient. I was rushed to the OR after frequent blackouts, loss of time, and sudden onset fatigue. I worked a physical labor job and attended college after my shift, so I didn't think anything about the fatigue and the blackouts loss of time. I thought was just my brain giving me a fast forward through mind-numbing tasks. Typically I would have the blackouts while driving because my commute to work was about 45 minutes and my school was about an hour away from my work. I would get on the highway, blink, and I'm pulling into the parking lot with 45 minutes having passed in an instant. I told my girlfriend about this and she told me something was wrong, but being a dumb 19-year-old I thought my brain was giving me a fast forward through boring crap. It wasn't until I was at work stacking chairs when I had an empty cart, put a chair on it, turned around to pick up another chair, then turned back and the cart was full. When I saw the full cart, it was like someone hit me in the back of the head and I instantly felt like I hadn't slept in days. I ended up sitting down and one of my co-workers noticed I was white as a ghost. The guy in charge forced me to go to the hospital even through my insistence I was fine. Once I got to the hospital and got brain scans done, it turned out I was having mild seizures caused by a lack of sleep. When I told the doctor about my commute blackouts, he looked like he nearly crap himself. He told me he has no idea how I didn't crash and the sudden fatigue was basically my body both recovering from seizures as well as realizing how tired I actually was. He basically told me to find a new job and get more sleep. Doctors of Reddit, what is your most oh my god what is that moment while treating a patient? Not me but a friend. He was delivering a baby of a frequent drug user, and after the baby was delivered all that was left was a lovely afterbirth. Now, these are not pleasant things in the first place, but with the constant infections and wounds this woman had, she had somehow managed to develop a cyst or something pus-filled on the wall of the womb, which had ruptured during childbirth. What came out of that woman, he said, was the most vile thing a woman could birth, a mixture of afterbirth, rotten flesh and uterus lining and a decent amount of creamy pus, yellow, brown and red, MMHMM. The baby was fine though, quite healthy too. Remembering how nasty regular afterbirth is, I really feel bad for your friend. That's so disgusting. I'm not a doctor, but a couple of years ago I was talking to my dentist. She was complimenting me on my sparkly white teeth and healthy gums. I mentioned something along the lines of I could never be a dentist. I couldn't deal with those who have bad breath or rotting teeth. Then I made the mistake of asking what the worst case was for her. She told me about a time that a woman came in with pretty much all of her teeth completely rotten and an abscess on the back of her mouth. The dentist apparently started working on the back of the mouth and popped the thing. She described the smell as that of a dead animal. Apparently the smell was so bad that it permeated the thin mouth cover and the abscess had popped with such force that some of the pus landed on her shirt. I think of that story every time someone tells me I should do interpreting at hospitals. And I'm going to brush my teeth now. This is a nod to my grandfather, who was a doctor. Way back when, he was called out to a coal mine where a miner had been crushed by a coal cart. Apparently there wasn't much left of the poor guy, but as my grandfather was first on the scene as such, he noticed that the cart safety lever wasn't on. This is important, because if the deceased miner was found to have been operating the cart without the lever, the company wasn't obligated to pay his widow a penny. Needless to say, he flicked the lever into position and made a tragedy easier to bear on the remaining family. A friend who is a family doctor was treating a preteen girl who was complaining about a pain in the back of her neck. He did a preliminary examination and found a lump, and thought that it was likely his cyst that had become infected, and the parents agreed that he should remove it. That's when he noticed it move. Turns out it was a large botfly larva that the girl had picked up while vacationing with the family in South America. It was the size of a nickel. My dad is a nurse, I have asked him this question before, and most of stories are about people who come in with deodorant cans up their butts and try to claim that they were climbing in a windows and fell on the can or something. But there is one story which he has told me which really stands out. When my dad was in his mid-20s, he worked in the emergency department of a hospital. One day this morbidly obese lady comes in complaining of abdominal pain. They start to look her over. Everything was going fine until they decided to look in the folds of her gigantic stomach. When they smelled this horrible smell, they found a decomposed chicken wing covered in maggots which had started eating at part of her skin. Yum. She was saving it for later and forgot about it. Mom's an RN. One night, dude walks into the holding a bag under his crotch. Dude got drunk with a bunch of his friends. The DD drove a pickup, and this dude and his buddies sat in the flatbed, speeding down the parkway. The dude, in his infinite wisdom, decided to stand up. DD hit a bump. The dude went flying and found out why they call it a split. One night, dude walks into the holding a bag under his crotch. His scrotum and taint had split, and his testicles and his lower GI tract had spilled out. He was carrying them in the bag. Dude was rushed to surgery. Full reproductive capability restored. I have seen a lot of things, but the one thing that really sticks out is something I saw as a medical student. I was on a general medicine rotation and was seeing an elderly lady for urinary problems. Specifically, she was having trouble holding her urine. She mentioned in passing that she had something coming out of her vagina, like a mass, but she couldn't see what it was. My resident and I decided that we ought to take a look. Upon examining her pelvic region, we were unable to use a speculum to visualize the interior of her vagina because there was a firm mass protruding from her vaginal introitus. The mass was her bladder. It had prolapsed. There was a patient who came in, well-known history of diabetes. When I saw him, the worst of it was already over, but he still had legs like sausages and the smell in the room was like a garbage dump. There were these strange bands around his ankles that were indented to over a centimeter deep. Apparently he had developed an ulcer on his foot, so instead of cleaning it and bandaging it, he decided to just put a sock over it. Eventually the ulcer developed into gangrene and the pus began to soak through the sock. The smell became overwhelming even for him, so he decided to seek medical attention as a responsible adult would do. Just kidding. He put a plastic bag over it. Eventually the pus seeped around the edges of the bag and started leaking again, giving rise again to the horrific smell. So now things were getting out of control, so now he decided to get it properly looked at. Got you again. He put another plastic bag over it. This process repeated about 9-10 times. In the air they had been peeling off this giant mass of plastic and dead tissue glued together with pus and held on with elastic bands around the ankles. That's what the indents were. It was like his foot turned into a giant pus onion with each layer smelling worse than the previous one. 2 or 3 nurses apparently threw up and they had to rotate people in to do the next layer. He wasn't even in much pain because he had long-standing neuropathy in his feet, which was why he was able to ignore the problem for so long. And that's why you always leave a note. This will probably get buried, but my father-in-law was a doctor for 20 years. Twice he's been really surprised. We'll call him Dr. J. This first time was a patient that came holding his stomach, with the front of his jacket bloody. He looked very out of it and it was obvious he was under the influence of some drug. Dr. J asked him what the problem was and the guy calmly said, "My stomach hurts." "Well, let's have a look." Smack. As he pulls the guy's coat away, his intestines spill onto the floor. Turns out him and a friend were doing some drugs. One of them pulled out a loaded shotgun and accidentally shot the other guy in the stomach. He explained it very matter of fact. "Oh man, I need to go to the hospital." The story was years later. Dr. J had a male patient come in complaining of abdominal pain. He decides after an examination that they need to do a scope. So there he is, minding his own business, navigating through this guy's bowels with a camera when suddenly a light facing the opposite way blinds the camera. It turns out the guy was giving himself the old in and out with a flashlight and lost track of it. I have no idea why it was on. Dr. Jay had told the man he had to consult with another physician, then left the room and collapsed from laughing so hard. He said it was like watching a cartoon where somebody runs down a tunnel and meets a train head on, except the tunnel wasn't but and the train was a flashlight. I can imagine the flurry of activity that follows someone dropping their intestines on the floor of a hospital. That split second of comprehension, right before yelling for 24 things stat, is the ultimate calm before the storm. Worst in last 24 hours, patient after colon surgery returned to her with a wound infection. I took out a few staples to drain the fluid. Instead about 100 milliliters of feces bursts out all over the bed, patient gown, etc. Patient has a fistula to the bowel. Worst ever, went to see a patient with an ingrown toenail. It was just hanging on by a thread, so I froze the toe and pulled the nail off. There were maggots living under the nail, like, a lot of them. You get used to this stuff. The fistula was surprising, but I'm beyond being grossed out by it. However, the maggots really caught me off guard. IQ doctor in a major trauma center here, with years of her experience. Let's see. Group of intoxicated teens driving around town. One passenger in the back opens the window and projects his upper body out of the car while other people hold his belt. Stoned drunk driver sees this and decides to scare his friend by passing close to a street sign. Moments later, people kick in the door, screaming. I jump there. They grab my coat and drag me to the car, where a body without head and most of the arms rests hanging out the window. Freaked out dude tries to give me the head while screaming do something. Drunk girl riding a motorcycle forgets the helmet in the bar and decides to turn the wrong way in a one-way street. Hits car, flies head first into a street pole. Massive brain injury, making cerebral tissue swell, which would be the cause of a rather early death. But she was saved by neurosurgery and a basal skull fracture, making her brain insinuate out to the nose and helping relieve pressure inside the skull. Huge amounts of brain tissue came out her nose for days, and the nurses did a great job in wiping it constantly so the family never had to see it. She survived with major sequelae. Dude riding his motorcycle hits another motorcycle, almost loses his leg, discharged from the IQ very well, with a shaft inside his femur to help it heal. Goes berserk the day after and discharges himself from the hospital. A week later he was readmitted, the leg swollen red and copious amounts of green pus oozing from the surgical incision. Lost the leg, survived. Strange dude gets his ball sack pierced multiple times, at home, by himself. Ball sack got infected, his nuts were floating in pus. The infection had spread to the abdomen and fascia on admittance, causing necrotizing fasciitis. Awful smell. Lots of surgical removal of infected tissue, including testes, penis, rectum, bladder, all in vain. A good friend of mine is a nurse, and by nature has the best stories. She was working the med-surg floor in the hospital and had a female patient who was so morbidly obese that she needed a service animal to help her. No, not a dog, as most people would think, but a monkey. This lady had a goddamn service monkey. It would get her glasses for her, grab the remote for the TV, all kinds of things. Odd, but not really a WTF moment, until she walked into the room to take the woman's vitals and finds her breastfeeding the monkey. That was, yep. Not me, but a friend who is a doctor told me this story of when he just graduated with his medical degree from Johns Hopkins. A very large woman was being prepped for a gastric bypass surgery. When cleaning her, the nurse found a hard, crusty object in the patient's belly button. What was it? A calcified cockroach. Yep, the woman had no idea it was there either. Not a doctor, but when I was a paramedic student we used to do rotations in the ED. A guy was brought in from what I assume must have been a horrendous nursing home. He looked fine at first, but once they took his pants off the issue became apparent. His testicles were about the size of a football, and necrotic. It's called Fernier gangrene. He must have had it for quite some time as well, judging by the size, color and smell. He had a stroke in the past and was now much less alert than his normal. It looked painful, but the worst part was the smell. It smelled like rotten crab meat. One of the residents that came in to evaluate him looked as if he was going to vomit and left the room within 20 seconds. I felt terrible for the guy. He had no clue what was going on. and he clearly must have become used to the smell. When I went home that night, my roommates and friends decided to make appetizers. One of them brought mini crab cakes. The smell gave me an image of that guy's testicles immediately. It was the cruelest irony I could think of. My father was a plastic surgeon in the emergency room of a major southern city, so he has stories plenty. So here is one of the worst. A family of 4 was driving on an urban highway that passes right by the hospital. The parents were in the front seats and their 2 young children, boy and girl, 3-5 years old, were in the back seat, apparently unrestrained by child seats or seat belts. Coming from the opposite direction was a speeding and swerving woman driver in the throes of a psychotic episode. As the 2 cars approached from opposite directions, she swerved into the median and hit a barrier which launched her into the air, upside down. Her car landed on the roof of the family's car, bending the roof of the rear portion of the passenger compartment downward and backward in such a way that left the mother and father unscathed but neatly sheared off the top portions of both children's heads at the brow. The accident happened right in front of the hospital, so in a horrified delusional panic, the parents carried their 2 children into the emergency room, with inside of the craniums exposed and devoid of their contents. Obviously nothing could be done. That is so goddamn horrific, but at least his was quick for the kids. I'm not a doctor, surprise, but this happened to me when I was in 4th grade. I noticed a small lump in the middle of my tongue and thought, oh, I must have burned it, whatever. The next morning, however, it had grown by a lot. It was freaky looking, so I told my mom. She flipped out and took me to the doctor right away. Near tears along with my mother in the ear. She was not good at hiding emotion, and her fright was really scary. We waited for hours as she bothered the attending nurse to no end. Finally, they called my name and brought me to a room. It started as a normal visit until the doctor said, I've never seen anything like that. Cue mom's crying and my heart pounding. This was a freaking doctor. Growing up in a medical community, my 10-year-old brain was conditioned to think that doctors knew everything. So they brought in another doctor, and another. Then they put me on a dentist-style chair with huge, bright lights shining on me. Before long, there were 5 doctors and the chief of staff staring at my tongue. My mom was sitting silent in the corner, absolutely horrified. With a huge group of doctors surrounding me, I did feel a little more comforted, but was still very scared. So what did this brain trust of brilliant medical minds come up with? A biopsy? A CAT scan? Number. We're going to try poking it. Even at 10, I was thinking, can I get a second opinion? I could not, however, talk because they were literally holding my tongue. They sprayed me with a local anesthetic that tasted like mustard and the chief surgeon washed up, put on goggles and a mask. He slowly moved the shining metal prod into my mouth. I could feel the pressure on my tongue. He pulled back, looked at me and asked me possibly the grandest non sequitur I've heard in my entire life. When was the last time you had popcorn? I was completely caught off guard. A couple days ago I remembered clearly because I was trying to eat it quietly as we watched the X-Files Sewer Monster episode, original airing. You jelly. So the doctor sets on my chest bib thing a perfect half of a kernel husk. It had, apparently, suctioned itself to my tongue. And because tongue tissue is so quick to generate, it was essentially absorbed by my body. Lots of doctors laughing. My mom crying for joy now, and I was totally stunned. I even wound up in a big medical journal because of it. So I went to finish out the rest of the day at school and did an impromptu show and tell, which mortified most of my classmates. Then I got nauseous from the anesthetic and puked up my Cheerios in the nurse's office where my best friend was also lying down. Unrelated. All in all, it was a memorable day for me and likely the doctors. TLDR. I was inspired to start a band called Dr. Popcorn Suction Fiasco. I was a junior asked to see a man with a tracheostomy. The nurse had sent him in because it was bleeding. The senior asked me to head in to get a swab. When I pulled the apparatus away from his neck, maggots rained down across his chest and neck. Wife is a trauma surgeon. She's sleeping now, but I get about an hour every night where she unloads the horrible crap she sees. One that sticks out is the girl and her boyfriend on the motorcycle. They were taking a sort of underground turn from one highway to the next and he was going way too fast. He started to get close to the wall, so the girlfriend on the back decides, best idea, go ahead and put your foot up on the wall of the tunnel. Foot catches the wall. She flies off. Leg breaks at the femur and the broken bottom half of her leg drives straight into her gooch. She gets a middle-aged mail in for stomach pains. Says he was at a party, got drunk, woke up at another party and hasn't been able to juice in a few days. Tox screen comes back positive for amphetamines. C and weed, so a good night out. CT scan comes back with one. Full-size Glade air freshener can totally up this guy's butt. Bottom first. It is so far up that the colon has collapsed around it at the anus and created a vacuum behind it. They try a number of ways to get it out with no luck. Finally, she gives him a paralytic because his beehole keeps fighting back, and my wife is now double-fisted up this guy's butt. There is a picture of her holding the can somewhere out there. This is the second aerosol can she has removed from the butt of someone in town. First one was a full-size spray paint can. The man bought the can at Lowe's, placed it in the bag and inserted it with the handles of the bag hanging out his butt, thinking he could just use the plastic bag handles to pull it out. He broke the handles trying to pull it out. The bag still had the receipt in it. Lots of dog attack stories. Recent one is 8-year-old boy attacked by 3 PBs with more than 100 puncture wounds. 7 PB attacks this week, only one provoked. In accordance with the Reddit circle jerk party around here, they are not the most aggressive dog. They are, however, the dog most likely to cause injury or death during an attack by a wide margin. I'd have to get her on here to really do this justice, but with her schedule, not likely. This was back in med school when I was following an anesthetist to clerk this 60-70-year-old gent with penile cancer who had come in for a pinectomy. Simply put, to have his entire penis chopped off. We go into this room with the patient and his son, in his 30s, to see if the guy was fit for his op. He was decently kempt but smelled like he hadn't showered in a year. As we started taking his history, he shoved his right hand into his pants and started moving it vigorously, moaning as he went at it. Just so you know, the anesthetist and I are female, and his son was clearly having the most embarrassing day of his life. A very painful 10 minutes went by. Our clerking interjected with moments of "oh." A few hours later in theater, after sedation, we removed his gown, and voila, a 15 by 15 centimeters black necrose dong with ulceration and oozing pus stares us in the face. And the smell, I couldn't eat lunch after. At that point in time, I was glad I was still a student because I just said I had a tutorial to go to and fled the heck out of there. TLDR. Patient masturbated his rotting dong in front of me. That's ridiculously gross, but, and I'm sorry to say this, if I knew you were about to chop off my penis, I wouldn't mind one last hurrah to say goodbye. Not a doctor, but I work in the air. Had a female patient come in with abdominal pain. Begin examination. Noticed the worst rotten smell imaginable coming from her vagina. Upon pelvic exam with doctor, we pulled out a dead, rotten fetus that she miscarried weeks prior to coming in. One of the few times that I remember actually gagging. Will never forget the look and smell of that poor thing. I remember my dad, who is an obstetrician and gynecologist, was visited by some police officers while at medical school. They handed him a bucket of organs and proceeded to ask, "Can you identify whether these intestines are human or animal?" He also had another case back when he was doing house calls, where he was locked inside the house by a wanted criminal with a knife, who had disguised his identity. My dad climbed out the window, called the cops, and ran for his life. He emerged unscathed. Hahaha, I can imagine an OB-GYN student looking quite puzzled at that bucket of organs. Physician here. Hospital doctor for those wondering the difference. I fear this has turned into a gross out battle rather than a diagnostic quandary, but here goes. My most I have no idea what I'm looking at moment was the first patient I saw with McCune-Albright syndrome. I may have spelled that incorrectly. It's an extremely rare de novo mutation that affects endocrine organs, hormone secreting organs. So you get overgrowth of many of these organs and overproduction of hormones. They tend to be acromegalic. Think Jaws from James Bond. but they also get large facial deformities from bone overgrowth depending on severity. It's a horrible condition to suffer from but thankfully rare, and one for the gross out battle. As a resident in ED, I saw a youngish alcoholic female who the nurse was having a hard time passing a urinary catheter. I went to put it in, spread her legs and a ball of maggots poured squirming out of her vagina. Poor self-cares and lower leg venous insufficiency from child C cirrhosis causing skin breakdown equals maggots. As I stood there bent over in a state of shock, she let out a large fart which sprayed the maggots in a plume of death into my face. At that point I just walked out to wash my soul, reconsider my career and have a coffee. You can't make this crap up. Shudder. A famous Australian, he is in the entertainment industry, who was a trainee doctor, tells a great story of a guy who came into the OR with something up his rectum. They took x-rays and had to take it out. Turns out the patient had a hammer up his rectum. A doctor asked if he could keep it to put in his museum of things taken out of people's asses. The patient said no, the doctor could not keep it. The patient's reason: it was part of a set. Not a doctor but a nurse. Was working in emergency for first 5 years of my career. Old guy about 80 presents. Foreign body in his butt. Turns out to be a war vet. And had a live shell about the size of a slim Coke can up his ass, probably about 9 inches long. He was very stoic. However, we had to call Australia's version of the bomb squad to assist in the removal. Exciting days. Poor lonely old guy. TL. DR. Giza so artillery much insertion. As a medical student in a urology office, we had a young healthy male come in with problems urinating. He said he had hesitancy and a decreased stream. Pretty odd for a young male. So the doctor went through all the standard questions and it was a benign physical exam. Did a prostate exam and nothing was out of the ordinary there either, so after a couple visits a cystoscopy was done. A little black tube with a camera on the end is shoved up your pee hole to look at your bladder. Well, this guy had strictures all over the place. Extremely odd. So more questions like, have you ever had a catheter? Nonchalantly, oh yeah, hundreds of times. For what? Well, when my partner and I host parties I take a catheter and drain my bladder. We both thought that was strange and thought maybe he doesn't want to miss any of the party by having to pee. We were clueless. So then he states, and then I fill my bladder up with red or white wine. Okay, it doesn't work like that. Butt chugging sure, but not the bladder. So here comes the kicker. This guy would go around and pee in people's mouths to give them a drink of wine. It was a big gay orgy, come to find out. I just recently caught up with an old friend who is now an OR nurse, and she told me this gem. She was preparing a morbidly obese woman for surgery, scrubbing her down and cleaning the areas up underneath fat rolls that haven't seen the light of day in God knows how many years. When she picked up one particularly hefty roll around the side of this lady, near the lower back, she stopped suddenly. Is that a bone? She mustered her courage and continued to investigate. A moment later she uncovered the skeleton of a small kitten. The bones were fused with the still rotting flesh of the sad little creature. Holding back tears and vomit, she walked around to face the large woman. Mom, I don't want to alarm you, but I've just found the remains of a small cat in one of your fat rolls. Lady's response, seemingly unfazed, oh, I've been looking for him. Apparently people this huge develop rather thick calluses in their fat rolls from all the friction. This cat could have been clawing for life in there and she might not have felt a thing. Poor little guy died trying to claw his way out of heck. The cat and the fat. This is a little different, but I worked as a tech in a mental hospital. One of my jobs was to go through and catalog a patient's belongings when they're admitted. One day a woman came in for her 3rd or 4th stay. She's pretty disheveled, as per usual, and smells pretty rough, which means going through her bag will be no fun. I pull a pair of gloves on and get started. Opening the bag releases the most awful smell, like something had died in the bag. So, with my gloves on, and considering a second pair too, I dig in. I find normal stuff. Dirty shirt that has holes in it, used tampons, coins and cash that are sticky, bits of fur. Wait, I think, bits of fur? That's strange. And here at the bottom of the bag is more. I lift up some dirty pants and there it is. A dead cat, slightly rotting. Something had died in this bag. After she was kicked out of the last place she had lived, She stuffed the cat in the bag to keep it warm and safe, and apparently forgot it. While my wife was in medical school, she helped treat a patient who was having difficulty urinating. She and the doc asked all the preliminary questions, but they still weren't sure what the problem might be. So the doc orders an x-ray. She notices a tangle of dark lines in the patient's bladder. The doctor then went in to show the patient the results as she was thoroughly stumped. After the patient sees the x-ray, he freely offers up that he likes to take baby snakes and let them slither up his urethra where they ultimately die in his bladder. His reason for doing this? Well, he said it gave him a funny feeling. That's a trip to the psych ward right there. I am not a doctor but a nurse going on 18 years. Yes, I have seen some amazing things in my career. People talk about finding maggots in wounds. Well, we actually use them in our hospital to clean up wounds. Ordered from a lab in Cali, they are raised in a sterile environment and packed into a sterile specimen cup and shipped overnight. Normal application is 500-1000 maggots per wound. They are placed into the wound and secured with a mesh DRSG and left in the wound normally 2-4 days, then washed out and disposed of. They only eat dead flesh, usually air and felt, and do a tremendous job so that the PT can avoid surgery. I once had to put $20,000 on a young lady who came in with necrotizing fasciitis of her leg. It started as a cat scratch on her knee. PT ignored it over several days while it was eating her tissues. She came in unresponsive in the home and septic after keeping it from her family. When she arrived, the only thing holding her leg on was the muscle bone and dead tissue. The Points family wished to save the leg and avoid amputation. Surgeon said to do maggots. 5 hours later they were applied. She eventually lost the leg and underwent amputation. Early on in my career, we took a call for an unconscious unresponsive female. We get on scene and fire is already there. They are in full bunker gear with SCBAs. We could smell it from outside. This lady had a colostomy and developed C. diff. She rolled out of bed and the bag tore out. She laid in an ever-growing puddle of her own crap for 2 days before someone found her. The sores she had were so infected. The smell was awful. We had to drag her outside and spray her off with a water hose before transport. That ambulance was out of service for a week being deckened. Was working in a free clinic, and the residents of a halfway house came as a group to get checked out. I picked up a file, found my patient, and we went back to our little curtained off area. He seemed a little off, but so did many of our patients. High rates of drug abuse, mental illness, etc. Can't do that, so that didn't really throw me. I asked him what we could do for him today and he said, I want you to look at my head. I ask him what is wrong with his head, and he just says that it hurts and I need to look at it. I ask him to take his hat off. He says, I think you should have gloves first. That should have been my first warning. I assure him it will be fine, and he slowly takes off his hat. Underneath is a durag, so I still can't see anything, but that's when the smell started. It's a smell you can't really describe unless you've smelled it, but many of the other healthcare people here will know. It was foul, putrefying, like flesh was rotting. I can't even find the words. I ask him to take off the durag, and so he starts to peel it off. As I get hit full force with a wall of the worst smell I've ever experienced, I see his head is entirely covered with abscesses. Big ones, inches in diameter, all coalescing together to completely cover his scalp. Many were bursting open, with pus oozing out. His head was a minefield of pus. I decide that now might be a good time to grab some gloves. It turns out he also had similar abscesses in his armpits, which I looked at and confirmed, and in his groin, which I did not. Everything was oozing pus and smelling so incredibly bad. By this point the smell was permeating throughout the rest of clinic, and as close as I was to the source I don't know how I didn't throw up. Although he was in pain, he didn't seem to understand how serious it was. That level of infection anywhere is bad, but in the head has the risk of finding its way into the skull and therefore the brain. And it took a lot of persuading to convince him he needed to go to the ED for higher level treatment than we could do. This was near the beginning of my training, and I've seen a lot more gross things since then, but that's the moment that I always remember. Doctors of Reddit, what patient made you go, how the frick are you even alive? I had liver failure. When I was 8 months pregnant, my baby had stopped moving for several hours. So they did a C-section. They found out during blood work that my liver had failed. I almost needed a transplant. I bled so much that my body used up all its clotting stuff. I was in ICU for 3 days, in hospital for 2 weeks. My liver recovered. I went home with my son. We could both have died. The hepatology department and maternity department were working together, which is not a usual thing for them. So happy you're both here today. Patient here. When I was 7 I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night and found I was not breathing. Goes to the ER immediately because it was only like 10 minutes away. Not sure what happened while there, what tests they did, but I was declared dead. In the morning I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother, who hadn't slept all night. The doctors said they didn't know how the frick I was still alive. Now 16 and haven't had any hospital worthy complications since. And god dang it, my mom is the most amazing and loving person on this green earth. Your mom probably never slept again, holy crap. I'm a hospital medic and my first serious trauma was a guy that got shot in the neck. Somehow it missed everything important and went right through. Minimal bleeding, no C-spine damage. Just a hole through his neck that didn't pierce his esophagus, trachea, or any major vein or artery. Dude was just chilling in the room. And then 2 weeks ago we had a gunshot that would not have made it to the local trauma center. Hit his femoral vein but was still gushing blood. One nurse stuck her finger in the hole and it stopped the bleeding, and I found a second wound in his chest. No bleeding at all, it just looked like a weird indentation. We couldn't even tell it was a gunshot at first, and I stuck an IV adhesive sticker over it to vent it and prevent a collapsed lung. The guy's blood pressure was in the toilet and wasn't even able to read on the machine. We needed a manual check. By the time we got him sort of stable and with decent vitals, and got a surgery team in early, we were drenched in this guy's blood. Pretty sure most of what was flowing through him was saline and other people's blood. He survived though. We also had one woman whose entire abdomen was fully open under her belly, and everything in her was horribly infected. We basically told her we can't stop that much infection and she opted for hospice care. She was in so much pain I don't know how her family even got her to the ER. I lifted up a gust to look underneath since I was the first in the room to assess, and I was hit one of the most rancid smells I've ever experienced. Literally everything from the waist up was infected. There were some unnatural fluids draining right out of the completely open bottom of her stomach. I mean it when I say you could just lift it up and look right inside. I had lost a lot of blood to anemia and went into the doctor for something else. She starts looking into my eyes, my gums, pinching my cheeks and telling me that I'm several anemic and then said, "Are you always this white and pale?" And then I'm like, "Yeah, I guess." And then she made me take a test. Turns out my blood level hemoglobin was at 6.5 and dropping because of my heavy menstrual cycle and stomach issues not absorbing iron. I had gone into the doctor because I had really bad heartburn. And turns out that I was really low on blood. It explained all the dizziness, coldness, eating ice by the pound. Auditory hallucinations were happening and I started to just not care about anything. Had numbness in my whole body as well, and trouble breathing. I'd been in such a dire state that I started to accept all of these things as normal. When I checked myself into the ER, I told them that my doctor told me to come in, but I think she was overreacting, and I can probably just go home. They quickly tested me. My blood level had dropped a little in a couple of days and I still had heavy menstruation. They quickly admitted me to start my blood transfusion. They said that had I waited I would have likely gone into cardiac arrest or would have just died in my sleep. After the blood transfusion I felt amazing. I could breathe and my skin color was back. I had a patient in the emergency room who had been involved in an awful car accident where firefighters and paramedics spent an hour trying to get him out of his car. Reportedly, he attempted to walk to the ambulance and when he arrived he was awake and talking. Confused speech, but still. Then paramedics signaled the back of his head to me. His skull was popped open on the back so much that I could see inside. We paged the brain surgeon immediately and the patient was taken directly to the operation theater. Months later I heard from my colleague that he was still alive and had no damages other than some occasional balance problems. So not the doctor but the patient. I had a super bad allergic reaction that was a specific type of allergic reaction that was deadly on its own. It would have been deadly if I had only taken a small bit of the medicine I was allergic to, but the doctor that prescribed it accidentally prescribed about 10x more than what the maximum dose for that medication is supposed to be. So not only was I super allergic, I was also overdosed on what I was allergic to. So that led in 2 weeks of me being in the ICU and doctors thinking I had about a 3% chance of surviving at best. Every time I was conscious and had family visiting, a doctor would tell me to make the most of it because I probably wasn't going to make it for their next visit. Eventually I somehow recovered, but for about 2 years after I was still regularly going to several doctors to make sure different things were okay that were affected by it. Every single doctor I went to would hug me and would have other doctors and nurses come in and say something like, "Hey, you don't remember this because you were unconscious at the time, but I helped restart your heart," or "I was the person that vacuumed the blood and pus out of your throat that was blocking your air path," and they were just all amazed that I made it. It's been about 8 years since it all went down, and I've run into several of the doctors and nurses around the city and they still recognize me and still hug me. It amazes me how in such a large city with such a huge hospital that gets the most extreme medical cases from around the world that they still remember me being there. Not a doctor, but a patient. I was in the hospital after a pretty gnarly 4-wheeler wreck. I was destroyed, fractured my skull, broke 3 ribs, my right shin, it was sticking out of my leg, broke my collarbone, my right arm, had some pretty bad cuts, bruising, fractured 3 vertebrae in my lower spine, and internal bleeding. I've had a pretty high threshold for pain basically my entire life because I've always been clumsy stupid, but that was god awful, even after I was given pain meds. At some point, IDK exactly when it was, I was in and out quite a bit. I heard 2 doctors conversing outside my curtain. One of them said, "I don't know how she keeps regaining consciousness. There's no way she should be awake right now." The other doctor replied, "Honestly, I don't know how she's even alive. I think they thought I was asleep." IDK, but that scared the heck out of me. Not a doctor, but was the patient. When I was in boot camp, I developed an upper respiratory infection during second phase. I didn't want to get dropped back a platoon, so I gutted through, got back and went to sick call where they treated me for a host of things. When they x-rayed my chest, the doctors came out with my films and literally asked, "How the heck are you still alive? Your lungs are so full of mucus you should be dead." Turned into walking pneumonia at some point. I also had athlete's foot that turned into cellulitis and my last wisdom tooth yanked. So the combination of meds they had me on was enough that I don't even remember that week at all. I'm not a doctor, but I did meet a patient who fell from a 5-story building, landed on his upper back, woke up in the hospital the next morning and got up walking around like nothing ever happened. Barely a scratch on him. Think about it, every time I'm in a building with at least 5 stories, just looking down like, how in the world did this guy walk away from that like he fell off his bike and took a nap? Actually, I've seen worse injuries from someone falling off a bike, lol. I'm a midwife and we have patients who have massive obstetric hemorrhage, which is classed as any blood loss over 2 liters. This can happen for a variety of reasons. We had a patient who unexpectedly started hemorrhaging following an uncomplicated normal vaginal delivery and we just couldn't stop it. As soon as we pumped blood in, it hosed out. The doctors had to perform an emergency hysterectomy and the bleeding stopped. I think it's fair to say we were all shocked, not just at the incident itself, but at the fact that this woman lost 8 liters of blood. Also, that she spent just 1 night in intensive care before she was back on the ward, caring for her newborn, and she was home within a week. Women are bloody awesome, excuse the pun. For reference, women usually have between 4.5-5.2 liters of blood circulating in their body, hence 8 liters is very scary. This was many years ago, so I can't recall the exact details, but basically, we had a lady on ventilation with sepsis and multi-organ failure, renal failure, respiratory failure, metabolic acidosis, deranged liver enzymes, the whole works. We counseled the family and they agreed to withdraw life support, so DNR was issued and we took her off her ventilator. A few days later she's still around, unconscious, still in full-blown sepsis with multi-organ failure. but brainstem functions were there. I remember looking at her charts with my registrar, I think resident in the US, and my registrar going, but how? Then one day, maybe about a week on, during visiting hours, the patient's son approached us before he left to thank us for looking after his mother. His parting words were, and I kid you not, I don't know if it's relevant, but my mother practiced black magic. My registrar made the ward sister contact the hospital chaplaincy team to inquire if they do exorcism. They don't. First day of my emergency medicine clerkship, saw them wheel in a motorcycle accident guy who had dozens of broken bones, arms, legs, skull, etc., amongst significant soft tissue injuries. GCS was in the single digits. Had a decent pulse when they brought him in, but it was fading fast. Fast scan showed he was pretty much bleeding into every space in his abdomen and pelvis. The guy looked dead. His co-rider had already been pronounced dead in the field. Hands and feet were the same color as the white sheets on the gurney. Pulse was barely palpable. Lips were blue, etc. Anyway, the trauma surgeon apparently sees something or has a flash of inspiration. I stepped away for like 5 minutes while they were putting in chest tubes to go check on one of my other patients in a different room. Because as I head back over to the trauma bay, they are whisking this guy off to the OR. I hear from a nurse the next day that they cracked his chest, called in vascular and CT surgery in conjunction with the trauma surgeon to stop all the bleeding, and then closed him up once he was hemodynamically stable, but obviously in grave critical condition. There was no telling in the short term what kind of neurologic deficits he'd have from the fact that at one point, 80% of his blood was chilling in his abdomen rather than his vessels. Heck, I didn't even know if the guy's spine was intact or if he'd be paralyzed just from the physical trauma. Anyway, lo and behold, exactly 30 days later on my last day of emergency medicine, I bump into the guy and his family members leaving the hospital through the main lobby, holding fresh discharge paperwork in hand. He's being pushed in a wheelchair because you can't really use any arm strength without splitting your sternum open after the kind of surgery he had. But dude looks good. He's laughing and joking with his wife and trying to tell her that he can walk out of here if they'd left him. Pretty crazy considering when I saw him he was pretty much a broken corpse. My blood sugar was more than 1000 when I was diagnosed with type 1 diabetes. I was less than a year old. My mom had taken me to the doctor's office 4 times in 3 days, but the nurse called her a nervous mother and sent her home. Also diagnosed with Addison's disease a couple years ago. I'd probably had it for months and had been living on my own in a town where I knew nobody. The day I got home I basically had a conscious blackout. Happened a few more times over the next couple weeks and I lost the ability to sense low blood sugars. When I was finally hospitalized I was in Addisonian crisis. Took them 3 days to bring in an endocrinologist, and he knew what was wrong within minutes. They told me my heart would have stopped within a week due to low sodium high potassium. Not a doctor but a registered nurse. Last summer between the months of June to September we had a young male, 19 years old, who crashed his motorcycle and was sent flying through a van's windshield. By the time he came onto my unit he had gone through so many operations and I heard he needed to have over 100 blood transfusions within the first month to keep him alive. He also ended up losing all movement and sensation from the belly button down, as well as losing his left arm. His right arm was intact but barely functioning. Neurologically he was with it. Knew his name and that he was at the hospital, but I honestly don't think he knew what happened to him. His family members were very nice and I could only imagine how they were feeling. I honestly have no idea how he was still alive. He couldn't sit up straight anymore because he would be in terrible pain 24/7, but if we laid him flat he couldn't really clear his secretions. I'm surprised he didn't get pneumonia or aspirated or something else. We discharged him to a long-term acute care facility and that's the last I heard of him, but it's just such a sad story considering he is only 19. What a tragic story. Not me, but it's this thing my dad used to tell my sister and I. My dad served during the Gulf War and said he had to work on a guy whose head got ran over by a tank. What happened was a Marine fell asleep against the treads and the tank drove over him. Guess the fact they were in a sand and wearing a helmet saved him, but only barely. My dad said the guy was still incredibly messed up. He never went into specifics. My old roommate's wife came to our apartment one night after working in the air She is an NP now in a practice, but she worked in a hospital for a while. A patient had jumped off his 3rd-story balcony and landed in a bush and was totally fine. So naturally, he tried again. The second attempt, a branch got lodged up his butt. When they removed said bush from his butt, he lost the elasticity of his sphincter muscles. The man will never be able to not crap for the rest of his life. I'm fairly certain they can give you an artificial sphincter now. I'm late here, and not a doctor, but late last year, my dad went to the hospital early in the morning with terrible stomach pains, thinking he had a bad ulcer. My mom called me at 7 AM to tell me he had had a heart attack. A couple hours later, after an angiogram, the doctor tells us that he has multiple artery blockages, including the LAD, commonly called the Widowmaker. He has probably been having heart attacks for years, and he has just shaken them off like it's nothing. He had a quintuple bypass at 8 AM the next day, and he is almost totally recovered. We are looking forward to going to a theme park this summer and riding roller coasters with doctor's approval. My grandfather is a medical anomaly. His doctors hate him so much. He cut out a cancer lump with a pocket knife. I was like 9 and held paper towels. Cut his thumb in half. Stumpy. Then the pointer on the adjacent hand, the long way, looks like a claw. Cut a hole in his middle. I was young and helped clean and bandage. Survived a stroke. Has a brain aneurysm, a hernia, and like 4 teeth. He's a frickin' mess, but still kicking. My grandma was similar. Had aggressive skin cancer and bought carbolic acid from the vet and would burn it off the man. Then we cut and debride until we got to healthy bloody tissue. Like more than 20-30 times I helped her as a small kid until I got to be a teen and refused because I was scared I'd kill her. Just thought of a case I had while working in stroke rehab. Not a doctor, but I saw her scans. Like 60-70% of her brain is gone. The woman had a headache years ago when she's in her 30s. Went to the ER and doctors told her it's a flu, gave her painkillers and sent her home. Needless to say, it got worse. She went to the hospital again after at least 24 hours. Think she waited 4 hours in a bed before getting an MRI, and by then, according to her family, she's already not that conscious. The doctors said it's a small hemorrhage that bleeds slowly and the tear got bigger. She got emergency decompression and clot evacuation, but it's still 36-48 hours too late. She lived because the op saved her brainstem, and her family is well off enough to afford care staff and continuous rehab. But her mentality is like a baby and she could not even sit up. Sometimes I wonder if saving her life is the right thing to do. I was very early in. This kid hit up a convenience store near the hospital where I was working. Killed 2 people, 1 a kid. He had been beat to crap, shot, and wrecked his car. Thanks to the magic of CCTV and video monitors, it was all recorded. That was his last free day. My job was to get him in and out. We go him up and running. And the real hard part was seeing a 19-year-old realizing life as he knew it was over. He made his choice. Dang though. Holy shit, this was last October. I am a medical student. I had a patient who was 103 years old hospitalized for sudden loss of consciousness. She woke up next morning, discharged 4 days later. She just had a hypoglycemic attack. She is a retired nurse who worked during World War II. Not a doctor. Former EMT. One time got called to a guy who had been stabbed in front of a bar. 30 odd wounds. Face sliced halfway off. Bowels out. Sucking chest wound. Impossibly severe bleeding. It was an absolute mess. Dude apparently survived. 3 days-ish later, different guy walks out of a different bar and trips on a curb and hits his head on a patio table. Talking to us on the way to the hospital. Dies 2 hours later from a brain bleed. Sometimes you just don't know. I am in a dock. I had a sweet little girl accidentally get caught on some rope that wrapped around her neck while going down a slide, causing her to fall off the side and hang herself. Her dad does CPR on her until paramedics arrived. She came in with a pulse but not breathing. We put her on the ventilator but couldn't get her oxygen up because the lungs fill with fluid after a hanging. She got put on an ECMO machine. Oxygenates blood and bypasses the lungs so they can heal, which was a Hail Mary at this point. In the ICU she develops abdominal compartment syndrome and has to have her belly open up at the bedside. She then proceeds to lose her heartbeat 8 times, including 3 times from developing a spontaneous pneumothorax and once from a nurse tripping over the ECMO power cord lol. And the doctors and nurses in the ICU get her back all 8 times. She survived it all and was discharged from the hospital 100% neurologically intact. Kids are amazing. I visited her before she got discharged and cried with the family seeing how great she looked. Best case of my career. Nurse here took care of a man who had a platelet of 4. Yes, 4. Minimum is 150,000. I was literally surprised he didn't bleed to death from just turning in bed. Had to send him from nursing home to the hospital at that point. Then he came back and still had platelet of 4 when labs was done a few days later. Out he went again and came back. Did labs and platelet were 3. Sent him out again. He finally came back and was admitted to hospice. He had this rare form of thrombocytopenia and while platelet transfusions were given, they didn't help much. I was amazed that those 3-4 platelets keep him from bleeding out that long. Him and his family were very nice though. I'm not a doctor, but I do know a story that surprised most doctors. I am currently 19 years old. My childhood was quite normal at first, but everything became quite dark when my grandfather got cancer in his testicles. When he started chemotherapies, everything was very hard for him and for the whole family. My cousins and I used to visit him after lessons. A couple of years passed and our grandfather recovered from cancer. But the smile was erased when they told us that he had metastasis, so the cancer spread to the part of the rectum. He had to start chemotherapies again. Luckily the cancer was not as serious as the previous one. Although it sounds strange, my grandfather survived and cured of the second cancer after a year. There were no longer any forecasts of any other terminal illness. At 17, my grandmother passed away, which made our grandfather move with my family. But being quite impatient, he would go out from time to sunbathe and feed the birds. He went to the park by bus. One had done at night and my grandfather had not come home. He took the bus but the driver was drunk. The bus crashed. 4 people died and 7 survived, of which my grandfather was. We did not realize that he had disappeared that night. The next morning we found him in the hospital sitting as if nothing had happened. We all burst into tears as he complained about the decanter while laughing. My mother joked that God had forgotten to take our grandfather to heaven. This year my grandfather got the flu and we went to the doctor. After writing the medical history, the doctor almost dropped his eyes when he saw that he was still alive. I had an adult patient who was missing the right half of the brain. I know a dude with only half a brain. He's totally normal. Cardiac surgeon here. Had this happen twice. It's called an infarct aneurysm. After a severe heart attack, the dead heart muscle balloons outwards with every beat. Not completely compatible with life with progression of time. What was shocking was, the aneurysm ruptured in these 2 patients and was resealed by the pericardium spontaneously. It was literally a hole in the heart wall on the outer side being patched by a thin membrane. Ticking time bomb. One of the patients got operated, is now fine. The other one refused surgery. He walked home. Not a doctor, but a witness of a doctor saying this to my grandpa. The guy was not even 40 when he was diagnosed with esophagus cancer, which had spread to his lymph nodes in his neck. He was operated but was told he would probably never be able to eat solid food again and have difficulty speaking, as the main tumor was located on his larynx. Chemo and radiation was used to treat the spread in his neck, but there was a high chance he wouldn't survive it as the smaller tumors were inoperable. But he survived. He learned how to swallow again and regained his speech. All was good. Then he got a stroke. Within the year, doctors thought it could be his artery in the neck, damaged from radiation treatment that created a clot. So as he had just recovered, he was now unilaterally paralyzed by the stroke, and again unable to speak or swallow. Years later, he is now able to speak and swallow again, and part of his paralysis is recovered, or he has a way to work around it. Due to him being 50, cancer strikes again. He now has tumors in his prostate, which is spread to his testis. They remove most of it and radiation and chemo do the rest. Now the poor man has no testosterone production anymore, so he is put in artificial testosterone. He is now almost 80, and a few years ago they found multiple dormant tumors, some in his bones, and one in his prostate. They have been treated with chemo and are now under control. He is weak as a stick sometimes, but always recovers. His doctor said to him, the last time he was in the hospital, that he has never seen a person going through so much illnesses and cancers for 40 years, which each one a slim chance of survival, but always recovering. My grandpa, a slightly religious man, said, when the angels are calling, and I think I might finally lose the fight, I turn off my hearing aid so I keep fighting. Patient here. I had a giant tumor pressing on my spinal cord. It's a kind of tumor that is super rare to be located in the cervical spine and exceedingly more rare to have so young. When the doctors found it, they said I could have been paralyzed from the neck down in a month or so. I was in surgery in less than a week. The tumor was also pressing against the important artery that is right next to that area of the spine. There was a chance I would bleed out during surgery if it was accidentally nicked. Also, the surgeon said that if the tumor had damaged the nerve ending it had started to grow on, then I would lose usage of my right arm. I'm only 21 and I am right-handed. 6. 2 hours of surgery later, I wake up with an 8-inch incision down the back of my neck, and no in-surgery complications. My arm works just fine and I have all the feeling back in my body that I had lost. I'm finally able to tie my shoes again after losing fine motor movement in my hands. I have an appointment on Thursday to see if the tumor is growing back at all. Wish me luck. Not a doctor, but the patient my neurologist was totally confounded by. At the age of 21, I began having episodes of semi-consciousness, which lasted 2 months. My doctor could not figure out what was causing the problem, even with repeated blood tests. Then one Monday night, I prepared for bed. The next thing I knew, it was Friday afternoon. I was intubated, hands and feet bound to the hospital bed. Come to find out, my seizure medication had stopped flushing out of my system and was shutting down my body. My sister had found me in the floor beside my bed on Tuesday morning, seizing in my own vomit, which I had aspirated. I apparently spent the majority of my time seizing over the next 3 days, as my doctor kept changing medications to stop the seizures. He had told my family to start funeral proceedings sometime Thursday. On Friday afternoon, I awoke, scared to death by my situation. Not only did I survive, but so did the child I was pregnant with, unknown to anyone. 30+ years later, I'm still plugging along and that child has children of his own. Until retirement, my doctor continued to refer to me as the one patient he would always be amazed by. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.